Dysgeminoma.
Yeah, dysgeminoma. Mm-hmm.
LDH is raised. Semoma
Yes,
bodies
very
are
good. Yeah.
Semoma bodies are histological features of ovarian papillary cyst adenoma. Semoma are composed of calcium.
Yes, very good.
Ma'am, next question is not here.
Okay,
This
let
one.
me. Okay, let me present. Is incomplete. Mm, yeah.
Which cancer is most commonly diagnosed in pregnancy and postpartum? Ma'am, breast cancer.
Breast cancer most common.
Yeah.
Yes, it is going to be breast cancer. Yes.
uh, Clear's test is test to quantify the amount of fetal blood in maternal circulation following fetal maternal hemorrhage. What is basis? HbF is resistant to denaturation by acid. It's given.
Yeah, because it does not have its option. The same question that we did yesterday. Rubina did it. Yeah, this one.
Yes, ma'am.
Yeah.
Commonest type of vulval cancer is, ma'am, squamous cell carcinoma.
Yes, very good. It is squamous cell carcinoma. That is the most common one.
In preeclampsia, what changes occur in kidney? Vascular endotheliosis, acute renal failure, glomerular nephritis.
Hmm.
Wait, here occurs more. A.
A is vascular.
I'm guessing, ma'am. I'm just
Yes,
guessing.
in preeclampsia, yes, vascular endotheliosis occur. Yeah, very good.
Most common type of degeneration factor. Remember, highlight.
Yes.
A 42-year-old perimenopausal woman complain of 12-month history of heavy vaginal bleeding. Pelvic examination is normal. Her husband has vasectomy since 2 years. Her family is complete. Which investigate you will do before starting treatment? Ma'am, I think we did this question. Complete blood
Mm-hmm.
count, arrange for ultrasound, perform an endometrial biopsy. Ma'am, ultrasound.
Yes, very good. You will do ultrasound.
Now, first question which we did, we will do complete blood count that you explained to us. Twin pregnancy, rash on abdomen,
Ma'am,
especially
you
at night.
said CBC
No,
previously.
that female was not normal, Nupur. That scenario was different.
No, it was same.
I
No,
got it.
no, no. I do remember because we discussed it. Ma'am told us that she's in shock. She's not well. She has low BP or what. We
No,
can't
no,
wait for scan.
okay. Maybe that was different, but I read this somewhere, ma'am, in some guideline or something. If
Hmm?
any patient comes with abnormal bleeding, the first test we do is complete blood count. Then
No,
we
that
go
is
for
the first. No, that is the first test that you do. But what they are asking, which investigation will you do before starting the treatment? They're not asking you the first investigation.
Okay.
That was something different. Ma'am explained it
Yeah,
very
that was
nicely,
yeah, that
Nupur.
was that
That then I we say that here it's different because ultrasound is not commonly done and all.
is always they ask you with HMB or with any sort of bleeding. They ask you what is the first investigation. That is always going to be complete blood count or CBC.
Yes, ma'am. Ma'am, twin pregnancy,
Mhm.
rash on
Uh,
abdomen.
the answer is ultrasound or
G. Yes, yes, yes.
CBC now.
Ultrasound.
Yes, ultrasound.
Okay.
Twin pregnancy, rash on where is it? Linear diagram. Rash was not in any other place. ALT normal. Ma'am, biles are normal or not?
Yes, they are normal.
Alkaline phosphatase mildly
Everything is
raised.
normal here. Yeah. Slightly raised, but
Polymorphic eruption of pregnancy. But this
yes,
question
very
is
good. It is going. Yeah,
pass and Ashi.
yeah.
Most
It is
common type
falling. Hmm.
in fallopian, ma'am, adenocarcinoma.
Yes, fallopian tubes adenocarcinoma, not the squamous one. Yeah.
Yes, ma'am. Patient with complete mole pregnancy with ultrasound showing bilateral cyst with thin septa, theca lutein cyst, PCOS, corpus lutein cyst, follicular cyst, molar pregnancy with ultrasound. Ma'am, theca lutein cyst because in this beta HCG is also very raised.
Yeah, very good. It's the reason that is why he's having.
Ovarian solid mass on ultrasound begin histopathology with spindle-shaped cell, chest X-ray showing pleural effusion, diagnosis, fibroma, leiomyoma, endometrioma, dermot. Ma'am, her answer is given fibroma. I didn't know the answer. Well,
Fibroman, this is the same question we did it before also. Meek syndrome.
oh. Most commonly seen patient, urethral cancer. Transitional, urethral,
Yes,
no, that is bladder, urethral, squamous.
most commonly seen in female. Yeah, female. Yes, yes, yeah. If it's
Squamous,
bladder,
that
then
is
it is transitional. Yes.
it's bladder lens transition. A
Yeah.
woman got infection in the first
Squamous?
what? Squamous.
Squamous. Okay.
A woman got infection in the first trimester, rash, and joint pain. Later on ultrasound shows fetal ascites with no other structural defect. Ma'am, her answer is given Parvo 9. Parvo
Yeah,
answer.
because no options are given for this. Only this one is given.
Okay, joint pain and lateral ultrasound fetal ascites. So this is
Mhm.
Parvo. A patient is diagnosed as heavy vaginal infection, Trichomonas vaginalis. What will be the treatment? Uh, diagnosed having vaginal infection, what will be the treatment? 1 gram metronidazole, stat, metronidazole 400 BD for 5 days. Ma'am, metronidazole 400 BD for 5 days.
Yes, metronidazole will only be the treatment of trichomonas.
So, ma'am, this one 400 milligram for 5 days we will give.
Yes.
Okay, ma'am.
Either you give
Which
the
of
2 gram stat dose is 2 grams, or you give the 400 micrograms daily for 5 days.
okay, ma'am. Which group of virus causes molluscum? Ma'am, pox virus.
Yes, pox virus. Here the option is not given as pox virus.
Okay.
Mm.
Um,
Then
a woman got
another one.
infection. Wait.
Yeah, that is the same one.
Okay.
Yeah. Yes. Mm. Yes.
Patient came out to
Mm.
chlamydia positive.
Mm.
She's 12-week pregnant, which is management plan. She is chlamydia positive. She is 12-week pregnant plan. Treat the partner. Do not treat the patient till delivery. Treat the patient and screen the partner. Ma'am, treat the patient and screen the partner. This
Yes,
makes
very
sense.
good. Yeah, you are going to treat because because the infection can be acquired from the partner also. We need to test him also.
Okay, ma'am. Ask to use barrier method in pregnancy. This is how. Immunology, origin of macrophages, ma'am. Monocytes,
Yes, very good.
characteristic of IG.
Yes.
Cross placenta activates complement. Uh, make up 70% of pools bind to FC form antibody complex.
Mm.
Cross placenta bind to FC form antibody complex. That's A.
Okay. Yes, very good.
Which immunoglobulin is a main in mucosa? Ma'am, IgA.
Yes, IgA. Yes.
Which antigen presenting cells are mainly found in the cervix? Ma'am, Langerhans cells.
Yes. And in the placenta there?
Hofpons.
Yeah.
Rubella vaccine is which type? MMR. Ma'am, live attenuated vaccine.
Yes, live attenuated. Yeah, this paper of 2016 is completed now. Let me search for 2017 now.
Ma'am, every year two exams are given. This is 2016, which month?
It is not written that it is which one, which I
So
have
one
it.
paper we did 2016.
Yeah.
So we'll do another one now.
If do you have the other one paper?
Ma'am, wait, I'm searching. Wait, ma'am. It's in files. Ma'am, I'm looking for it. I'm seeing it.
Okay. This is okay, but it is not having with options.
Wait, ma'am. There are so many papers.
Okay.
Ma'am, I
Okay, let's.
forwarded both. Now look, see which one is
Yeah,
the
which one? The other one? No,
one is
this one I
2016
think.
and
Yeah, both are
one is
16.
March and
Okay,
one
so
is
yeah, we
September
did the
end.
yeah, we did the September one. Yes, we did. Now we are doing the March one. Okay, so you have both of them. Okay, but first, okay, first 16. Okay, can you all open this 2016 March one paper in the group because it does not have any options inside it.
Ma'am, they have
No, they have
written
just
answers.
directly no. Just only the answer is written. No options. Like two, three options are not given for them.
Oh, wait.
Like for every question. No?
Yes.
Ma'am, March 1.
Yeah, March 2016.
Okay, ma'am.
Yes, ma'am. Only answers are given.
Okay, let me post it. Okay, yes, sir. Take the first question. Yeah, started from first. Yeah,
The degree
whatever the answer. Let's do it. Even if the answers are written, so what? We have to practice it.
Ma'am, they are so.
Yeah, that is what I'm saying. Yeah, just
But
that you send
then,
me
ma'am,
the.
send whatever you want, which has
No, no, do
proper.
it because we'll have to do it because we have to do it. The paper is like this. Even after, so let's do it in the sequence. Why miss the change the sequence? So that we
Okay.
never.
The degree of X-linked dominant recessive. This is embryological origin of bladder trigote is mesonephric duct.
Hmm. Yeah.
Embryological origin of allantois is endoderm.
Hmm.
Embryological origin of bladder trigote, mesonephric, and allantois is endoderm.
Hmm.
Embryological remnant of mesonephric duct, Gardner duct cyst.
Hmm.
Asian women BMI 36, fasting sugar 46. This is normal.
Yes.
4.6 and 2. Yeah.
These
Data
are the normal.
interpretation of semen analysis. What are the features we see to calculate RMI, CA, ultrasound, and menopausal status?
Yes.
Calculation of RMI. Oxytocin antagonist is atosibart.
Hmm.
After how many units of blood transfusion we give FFPs? 4 units.
Hmm. It is going. Yes, it is. Hmm.
Okay. Uh, uh, Major hydrogen ion in buffer in urine. Major hydrogen ion buffer. Then phosphate is
Hmm.
main buffer. Most common infective cause of newborn anemia. Parvovirine.
Yes, parvati.
Dimer
Lemon
immunoglobulin
phosphate.
Hmm?
13.
Lemon phosphate.
Yeah.
Yeah, phosphate in the urine. Yes.
Which IgG is a dimer? IgA. Caput medusae is a remnant of umbilical vein.
Yes. This formed because of the umbilical vein.
Okay. Hematological and cardiovascular changes commences at in 8 week, 10 week, 12 week, 14 week. Hematological and cardiovascular changes.
Hmm.
8 week.
Yes, very good. Starts with 8 weeks.
Okay. Duchenne muscular dystrophy. Ma'am, it's X-linked recessive.
Yes.
Which immunoglobulins give passive immunity to the fetus? Ma'am, IgG.
Hmm.
Teen answer
Uh,
is 16.
8
Eight,
weeks.
eight, eight.
Okay. Caput means where is it? Sorry. Duchenne.
Question number 9.
Blood sup. Picture of Corey sac. Blood
Yeah.
supply of rectus below umbilicus is inferior epigastric.
Hmm.
Uniprestol acetate selective progesterone receptor modulator.
Hmm.
Neurotransmitter secreted on adrenal medulla is acetylcholine.
Hmm.
Endometrial ablation technique, which layer should be removed? Ma'am, both basal and functional layer are removed.
Yes, both basal and functional. Yeah, these are directly the answers are given in this. Yeah.
Okay. Pregnant lady of 36 weeks become unconscious at hospital car parking area. 36 weeks become unconscious at a hospital car parking area. What will you initially appropriate? Ma'am, call for help.
Yes.
After
Always the initial step is call for help for any emergency situation. The first option is please call for help.
After ovarian surgery, patient felt pain at the right side of the thigh.
Hmm.
Obturator nerve. But this is frequently
Yeah.
repeated question.
Yes.
What is the common inherited bleeding? Von Willebrand.
Yes. 1 milligram.
Enzyme used for transcription. RNA polymerase. 20 weeks pregnant with fever, backache, vomiting. Urine culture shows sensitive to nitrofurantoin. IV cephalosporin. What will you give?
Hmm.
Sensitive to nitrofurantoin.
Yes.
Ma'am, this question is incomplete. Why backache, vomiting, urine culture is sensitive to nitrofurantoin? We will give her trimethoprim.
Yeah. Try tropin in which trimester do we give?
Second and third.
Yeah, and try tropin second and third, and that which one nitrofloxacin in the first time.
First. Contrast used in MRI. Gadolinium.
Yeah, gadolinium.
Misoprostol. Progesterone E1 analog.
Mm-hmm.
Which increase before menstruation. This we done yesterday. Prostaglandin F2 alpha.
Yes.
Increased sweating in pregnancy. Where
Uh-huh.
is this given? Thyroid.
Um,
Study to
yes.
see the effect of soya milk and allergy. What is the null hypothesis? There is no effect of soya milk and allergy.
Yeah, that is called as null. Yeah, in which there is going to be no, or it is going to be rejected. Null hypothesis.
Which chemotherapeutic agent causes hemorrhagic cyclophosphamide?
Hmm.
Women of Mediterranean region trace HbA2, HbA, HbS. A है SBA, sickle cell trait.
Yeah, great. Because it has one S only.
Okay,
Hemoglobin
sacroiliac joint
S.
is synovial joint.
Mhm.
MRSA treatment, vancomycin or clindamycin and clindamycin.
Yes.
Labetalol mechanism of action both alpha beta agonist antagonist. Sorry.
Yes, it is going to be both alpha, beta, and
Gosh. Brain necrosis is the type of liquefactive necrosis.
When these are some question beta 1 and 2 option was this.
yeah,
Alpha and
that is
beta.
yeah.
Blood passes
The
from upper
answer was beta 2.
alpha and beta both.
Both.
But option the same question was alpha 1 beta 1 or alpha both alpha 1 beta 2.
Yeah, that previous question you're talking, na?
That
Yes,
was the
ma'am.
right one. This is direct one, Fakhra.
Yeah, it is directly given here. Like if it is alpha one and yeah, alpha and beta one, yes, then you will choose that one. These
Alpha
are
1
direct.
and beta receptor antagonist. This is.
Yeah.
Blood passes from a umbilical vein to inferior vena cava through ductus
Hmm.
venosus. This is given. Most common cardiac anomaly of clinical significance (VSD).
Hmm.
Most important ligament for support of urinary bladder. Pubocervical ligament.
Yes, it is
Ma'am,
given. So, hmm.
uterine support is through cardinal ligament, right?
Uterine support is through cardinal or also known as transverse cervical ligament.
These are same.
Yeah.
Okay. Terbutaline causes tachycardia. Erythrocyte enzyme for carbonic hydroxide is carbonic anhydrase.
Hmm.
Ma'am, it's done.
Okay. Now, Rubina, will you take the next question? Rubina here? Okay, let me
Yes,
post your
ma'am.
50.
Yes,
Yeah, okay,
ma'am, I
okay.
will.
Yeah. Let's Sadaf complete her 50 and then you can take it. Yeah.
Okay.
Okay,
Only
ma'am.
structures that leads through the lesser sciatic foramen, tendon
Hmm.
of obturator internus. Number
Hmm.
of carbon atom in androgen is 19. ECG interpretation, second, third degree heart block. ECG changes in pregnancy. ECG changes in pregnancy.
Yes, tell us what are the ECG changes in pregnancy?
I'm
Don't
left
remember?
ventricular hypertrophy.
Hmm.
There is uh, there's left ventricular hypertrophy. One was about axis.
Hmm.
Due to left ventricular hypertrophy, axis toward the left.
Yeah.
Mm, inverted T.
Okay.
T wave. There is T wave problem as well.
Hmm. Okay, read this for us. I'm sending this now. This one that I'm sending now. Yeah, read this.
Wait
Okay,
for here.
let me remove the options because we did this.
In pregnancy, the normal ECG is slightly different from daughter. That of non-pregnant women state, with changes reflecting the altered physiology of pregnancy. As pregnancy is associated with blood volume, increased stroke volume, and increased cardiac output, this is associated hypertrophy of the heart and enlargement of the left side of the heart. The gravid uterus also pushes the diaphragm up, and therefore it changes displays a heart forward to the left. The combination of these changes lead to the left axis deviation. This was right. There may be also T-wave motion or flat wave in lead 3 and the presence of Q waves in lead. Oh, I didn't say presence of Q waves.
Yes, in both lead and lead 3.
Okay. According to NICE guideline, where would you put sharp containers in ward? Out of reach of children and public under the bed near the nurse station where medicines are kept. I'm 50
Yes.
done.
Yeah, where do you keep it? Tell us.
This is rated
Yeah, you keep it in all
under
these.
near the nurse station where medicines are kept.
No, no, no. You have to choose one of them out of these. These three options are given.
So I've said that near the nurse station where medicines are kept.
Yes. Yeah. 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 Yes. No. Yes. Rubina, will you take the
Yes,
next one?
yes, ma'am.
Okay.
51. Sheehan syndrome affect which structure predominantly? Ma'am, anterior pituitary.
Yes.
Because of excessive bleeding and that. Nerve that passes our psoas major muscle is genitofemoral nerve. 53. Pregnant lady scared of having to have vaginal delivery as she had genital mutilation. On examination, she had absent clitoris. What type of mutilation is this? Type 1. 54. There was a picture of inversion from genetics. 55. Picture of chromosomal abnormality, diagnosis Patu syndrome. 56. BRCA1 and BRCA2 responsible for breast and ovarian cancer. What else? Options were pancreatic and colon cancer. Ma'am, colon cancer?
Both.
Both. Okay.
Yeah.
Cause of secondary hyperparathyroidism, chronic renal failure. 58. SI unit of absorbed dose of radiation is gray. 59. Ideal suture wound length ratio. Ma'am, they
Suture
are
to wound
asking
length ratio.
Yes. Wound to length ratio. What?
ma'am, we place the suture at 1 centimeter distance. What they are wound length ratio they are asking?
Wound length ratio. They're asking you that like wound. Yeah, the same one that you are saying, na, that wound is there, and it approximately how much space do we enter one? Like it is
Yes,
almost
ma'am.
1 centimeter, na?
Yes, ma'am.
So that is the in terms of ratio. Either you will be given the option of 1:3. You will be given. So that is the correct option. That is there for ideal
This is
suture
ma'am
wound length.
1:3.
So, ma'am,
Yeah,
1
one
ratio
ratio.
3 is what?
That is the suture. That the suture material is 3 times we take, and the wound length is 1 centimeter apart. Like in distance, we give 1 centimeter. After 1 centimeter space, we give the suture.
Yes, ma'am.
And the length of the suture material, that is either vicryl, monochromic, whatever it is going to be it is going to be 2 times more than the of the we take the stitch more, or we take the complete
Yes,
stitch, we
ma'am,
don't cut
so
it.
that we can tie it and
Yes,
for better
exactly.
suturing. Okay,
That is
ma'am.
why it is, so the ratio is 1:3.
Okay, ma'am.
Or sometimes they will give in as 3:1, so both will be the anything will be, but usually it
Okay,
is
ma'am.
1:3.
Okay, ma'am. 60 CTG baseline less than 100, that is bradycardia variability less than 5, no acceleration, late deceleration for 20 minutes. What do you do next step, ma'am? Cesarean section emergency. Cesarean
Yes,
emergency.
very good.
61 cell found at inflammation site is neutrophil. 62 cell death with cytoplasmic bulbing, apoptosis. 63 woman in labor, vaginal examination reveal a baby in occipito-posterior position. Which diameter is represented by this? Occipito-frontal. Ma'am, what's this?
You tell us. Okay, let's discuss the normal one. Tell us the normal diameter for for the vertex presentation?
Ma'am, occipito, ma'am, occipitomental is the largest one, that is
Hmm.
13. It cannot be
That is also
delivered
called as
normal.
which presentation it is called?
Submento
Face,
vertical
Yeah,
ma'am, bro
pro presentation.
presentation.
Yeah,
Bro
pro
presentation.
presentation. Yeah.
And occipito anterior is the normal presentation, ideal presentation that is
Hmm.
to be delivered. That is 9.5.
Yes. And
And
hmm.
occipito posterior,
Yes. We have vertex presentation. We have face presentation. So for face presentation, what will be the diameter?
ma'am, for face presentation,
Hmm.
it is, ma'am, it is also the, ma'am, it's not that much more, but bro is the largest. But it
Yes.
can got injury through vaginal delivery, so that is a
Hmm.
um, that is a dangerous thing. So, ma'am, face presentation is 11 centimeter. I remember. I don't remember.
Yeah, face is 11. This is also what I remember. Face is 11.
Okay.
And what other? Do we have any other presentation? We have face. We have bro.
So we
Uh,
have vertex.
Vertex suboccipito. Yes, vertex suboccipitobrachmatic is what one?
Mm,
Suboccipitobrachmatic also we had one.
yes, ma'am. Suboccipito.
Mm.
Ma'am, that is the ideal one, na?
Yeah, that is the ideal one.
Suboccipitobrachmatic.
Yes, that is the
Yes,
ideal one.
ma'am.
Yes.
So that is basically occipito anterior as well.
Yeah,
That is
occipito entry.
suboccipitobrachmatic.
Any other do
That
we
is
have?
9.5. And ma'am, we have the mentobrachmatic as well. That is the bro
Mentobrachmatic.
presentation.
Bro is no,
No, no.
bro is
Human face
vertical.
is mentopragmatic face presentation.
Face presentation, okay. Mm,
Hmm?
ma'am, do you have explanation of this?
No, these okay. There's a very good chart in that in the send details. I'll send that chart. Where
Please,
all
ma'am.
them. Yeah. Okay. Okay. Oh, okay. Vertex is suboccipitobrachmatic, face is submentobrachmatic, and breech is what?
That
ma'am,
is
breech can be of three types: extended breech, flex
Flex
breech,
sling and
Yes.
foot link.
Hmm.
footling breech.
Hmm.
So, ma'am, footling is the contraindicated for normal delivery because a head can later on stuck in it, and
Yes. Yeah.
the
Foot is a contract.
diameter is less, and it can
Hmm.
come out from a small
Yes.
diameter. That the head, the cervix is not fully dilated.
Hmm.
And ma'am,
then
um, uh, flex breech is the extended breech is the ideal one for
Hmm.
the vaginal delivery, in which
Yes.
we have the knee joint also extension is present, and the foot is facing the face of the
Yes.
baby. And the third one is the
The
flex
flex
breech.
breech. Yes.
That is the flexion at the knee joint.
Yes. There's a flexion at the knee joint. Yes.
Next, 64.
Hmm.
Neostigmine is anticholinesterase. 65. Structure produced after the first meiotic division is primary oocyte, and ultrasound showing teratoma. 67. The why carbon dioxide is used in the treatment of endometriosis. Mm, carbon dioxide laser.
Hmm.
For ablation, it is used. for for small spots for that we want to ablate it,
Yeah, for the
then we use
ablation and
carbon
yeah,
dioxide
for the
mask.
ablation,
Exactly.
and at the same time it will control the bleeding at the ablation site also.
Ablation site as well. Yes, yes. Mode of action of pertussis vaccine.
Just tell it is what type. It is live or what? Toxoid or what it is type. Pertussis. DPT. Diphtheria, pertussis, and
Sorry.
yes, it is which type of vaccine?
Ma'am, live attenuated.
DPT is live attenuated. Uh,
Ma'am, MMR is live.
yeah, MMR
Live
is live
attenuated.
attenuated.
Yeah, I think
Yes.
this is the one.
This is DTP.
DPT.
Yes. So what
Ma'am,
it
it
is
is
going to be?
killed. Killed vaccine.
DTP is kill. Yes, Sadaf.
Ma'am, you asking me?
Yeah, tell us.
Ma'am, it's kill.
All the three: diphtheria, pertussis, and tetanus. Or only.
Tetanus is toxoid.
Yeah, it is tetanus. Yeah. Yes, it is a killed vaccine. Yes, very good.
Yes, ma'am.
It's an example of
Ma'am.
a killed vaccine. Yeah. I also forgot it.
69.
Hmm.
Patient with a history of irregular menses since 2 years, complete cessation for last 3 months, lab values FSH3, LH4, beta HCG less than 5, TSH7, prolactin 35. Options are hypothyroidism, pregnancy, Kallman syndrome, PCO. Ma'am, FSH, LH to FSH ratio is not 3:1, so PCO is rule out.
Yeah, PCOS.
Um, Beta HCG is less than 5, so pregnancy is also rule out.
Yes.
Prolactin is 35 is also in a normal range.
Hmm. Or it may
TSH5
not be normal because again the unit is not mentioned. That what is the unit of prolactin? Yeah.
TSH TSH will be, I think, raised, so it is hypothyroidism.
But for only TSH we cannot tell hypothyroidism or hypo because we need to know whether it. What about T3 and T4?
T4.
Yeah.
Yes, ma'am.
So again, this question is an incomplete one. We
Okay.
really don't know what the other values.
Okay, ma'am. And ma'am, Kallman syndrome is given, but it is also because FSH-LH is normal, like so.
Because
Nothing.
none of the feature is mentioned
Yes,
like for
ma'am.
Kalman
Other
syndrome either.
yes, ma'am. And previously the patient was having menses, so it can also be ruled out.
Yes.
70. Complete protein synthesis occur in liver. 71. Urea cycle occur where in liver. In statistics, there was question to calculate odd ratio, negative predictive value, formula of negative predictive value, number needed to treat, perinatal mortality rate.
Hmm.
Ma'am, odd ratio AD divided by BC
Yes, 80 divided by PC, yes.
and mm, negative predictive value is true negative over true
Hmm.
negative plus false negative.
Yes.
And formula for negative predictive value is the same. And the number added needed to treat. What is this, ma'am, number needed to treat?
One minus 1 upon attributable risk rate.
Okay, ma'am.
Yeah, in the last lecture we did this in NTT, in NTU, in NT.
And perinatal mortality rate is equal to number of deaths divided by live births into into Rate is into 100,
Into 1,000. Rate
into
is 1,000.
1000. Okay, ma'am.
And perinatal ratio is also 100,000.
Ratio is 10 raised to the
Ratio is,
power 5, and
yeah,
that is
ratio
the
is always the,
comparison between these two,
Okay.
between two things. 73. Why remifentanil used in patients controlled analgesia? Answer may be an option yesterday. No. Okay. 74. Data interpretation of hypertension. 75. Dihydroepiandrosterone arrow going down. Answer androstenedione. Okay. 76. Question of placenta invaded the myometrium, reached up till serosa. So placenta percreta. 77. Mechanism of
Up to
action
the
of,
serosa.
yes, it has crossed all over now. Accreta
Okay.
is the it has joined. Increta is it has invaded the
So
myometrium,
it's
and
percreta.
percreta is crossed
This
all
is
over.
up to the serosa. It
So
doesn't
it
breach
has
the
reached the
serosa.
serosa. It has reached the serosa. Reaches
But
up to
it
serosa.
doesn't breach the
I
serosa.
did this question previously, but it was my answer was wrong, and I read it somewhere up to is for Krita.
Yeah,
So
Oh,
yeah,
because
that meant ma'am
Increta
told us that when
is,
it breached the
yeah,
serosa,
yeah. No,
it
but I read it
prevented its
somewhere
percreta. Can
that
what
you
did
up.
you
spell
read before?
everything, Rubina?
Ma'am, this question
uh,
I had
Mm-hmm.
solved, and then we had
Yeah, we
concluded.
decided, yeah.
But then in the key only it was written that it's per Krita, or maybe in past MRCOG I read that it's per Krita. Up to Siroza per Krita.
Okay, up to Serosa is for Krita. You
But
okay, so
you guys, when you discuss, you say when it breached the
yeah,
serosa, it is percreta.
yes, yeah, exactly. Because always we
but
have been
Siddha,
studying like this. Hmm?
what I studied is also like when it is invading the endometrium, it is um, uh, accreta.
Accreta.
When it reaches the muscular rear, then it is increta, and when it has reached till serosa, it is percreta.
This is what I have studied as well. But on that day, my when all discuss that was in my mind. If it's breached serosa, it is percreta. Now I got interpretation.
Now clear?
Yes. Thank you.
Okay. Mm, mm. 77. Mechanism of action of botulinum toxin. Mm,
If it is live, killed, okay, wait, what it is? Tell us.
mm. Ma'am, what will be the answer of this?
You tell us.
Ma'am, I don't
You
remember.
don't remember what?
Ma'am, decreasing
Mm,
release of acetylcholine.
Yes, yeah, it's the same question. Previously we did
Now
it.
send it. I've searched it on Google. Send it in group. Rubina, you can see the something.
okay. Botulinum toxin act by binding presynaptically to high affinity recognition site on the cholinergic nerve terminals and decrease the release of acetylcholine, causing a neuromuscular blocking effect. The
Yes.
mechanism lead to the foundation for development of toxin as a therapeutic tool. Okay, ma'am. Thank you, Sada. 78. Passage of molecule occur through gap junction or tight junction. Not sure. Ma'am, gap junction.
In passage of Message of molecules. Yes, it occurs through gap, gap junction. Yeah. So then molecule.
79. Yes, ma'am. 79. In which phase of cell cycle preparation of DNA replication occur? G2. 80. Ratio of direct to indirect maternal death may be 3 ratio 1. 81. What are responsible for cervical cancer? Human papilloma virus 16 and 18.
Hmm.
82. LMP first March cycle 35 days EDD. Ma'am,
Hmm.
from 1st March. So it
Yes.
will March,
Yes.
April,
So
May.
what will be the LMP from 1st of March? Yes. Tell us what will be the LMP. EDD. Sorry, not LMP.
Ma'am, normally it is 8th December if we add
Hmm.
7 days in a
Yes.
days and 9th in a
Yes.
month.
Very good. But here the
In
length is
35,
35 days. So what you will
35,
do?
so we will add 7 days as well.
So it will become
8, 9, 10, 11, 12, 13, 14, 15.
yes, 15th of December. Yes. Very good.
December. ECG changes in pregnancy, right axis deviation, absent QRS, Q wave. Yes, ma'am, presence of Q wave. Ma'am, all these changes present.
No, no. All these they are not.
Ma'am, Q wave is present in the
Hmm.
pregnancy.
Yes. And what else is present? We just discussed it before. Now, just before. Yeah. Sadaf discussed it. Yeah. Told it. Tell us.
Ma'am, right axis deviation. Ma'am, in the
Left
lead,
axis deviation. In pregnancy, we have left axis deviation. And what do we have? We have T inversion in lead 3.
yes,
And
ma'am.
Q waves.
Yeah, and Q waves. Yes.
Q wave, yes. Yes, ma'am.
Ma'am,
Hmm?
uh, from 35-day cycle, ma'am, I forgot. I was outside.
Sorry, Sadaf.
Ma'am, in 35-day cycle, what we do? Plus
We
Sadaf,
add
7 days
7 days
extra.
more.
Add
yes.
7 days more, right?
Yeah,
Yes, because we normally calculate it for 28-day cycle. So
yeah, exactly.
35 is
Oh,
we will add 7 days more in it so that it become 35.
okay. Thank you.
84 most common side effect of terbutaline: hypoglycemia, hyperglycemia, maternal tachycardia, fever. Maternal tachycardia.
Yes,
Wait,
tachycardia
wait,
is
wait.
the most.
I don't have 84 question.
85 patient in labor with occipito posterior position.
Hmm?
What is the presenting part? Or suboccipitofrontal, suboccipitobregmatic, occipitofrontal, mentofrontal. Ma'am, occipit is facing backward.
Ma'am,
Mm,
Hmm?
I
yes,
don't have 84 questions. From 83, right after there is explanation, and then it's 86.
83, you don't have the question. So
If I,
close it and open it again. That must be because you must have been downloaded for you.
ma'am, it's like from 83, right after 83, there is explanation of the ECG changes in pregnancy, and then it's 86. I can send screenshot.
No,
This is the
83,
plan.
and
And
then
then
you have 86. Huh? Which question is then you are having?
Pregnant lady with one stillbirth and one live birth, two abortion. Ma'am, check. I have some
Oh,
screenshots.
okay, okay. No problem. Let's read her. What is she reading? Yeah, yeah, yeah. Let's see what she's. Maybe the outside, upside down, the sequences. Okay, let's read it. Yes, Rubina, tell us.
Okay. 85 patient in labor with occipito posterior. What is the
Hmm?
presenting part? Ma'am, mentofrontal.
Yes, occipital posterior is mentorfrontal
Yes,
because
ma'am.
occiput is on the posterior.
Yes, ma'am. In all other option, occipit is frontal. So
Yes, the
that is
occiput is
not
front.
true. Yes, ma'am. 86 pregnant lady with one stillbirth, one alive girl, two abortion. What get her para and gravida? Ma'am, okay.
Hmm? Yes, tell us. So how you will write this? What
Okay,
is the
ma'am.
gravida and what is the parity?
Ma'am, gravida 5, para 2, abortion 2, alive 1.
Yes, gravida 5. 1, 2, 3, 4, 5. Yes, gravida 5 and para.
Para 2 because one is stillbirth, one is alive.
Yeah, the para 2 plus 1 and a small plus
Alive
2.
1.
Yeah,
Alive
yeah,
1 and abortion 2.
yeah. Alive birth and abortion. Yes.
Ma'am, please check group. I have sent it this way. Gravida 5, para 2 plus 2.
Yes.
This way.
Yeah.
Okay.
87 cause of stria in pregnancy, melanocyte, ma'am.
Yes.
Yes. 88 what is complement, where is complement produced? Liver. 89 lens field classification of streptococcal depend on cell wall antigen.
Carbohydrate
90
of
after vaginal delivery patient lost lot of blood, now can't breastfeed the baby, complain of lethargy. What is diagnosis? Sheehan syndrome. 91 active form of vitamin D is 125 dihydroxycholecalciferol. 92 patient had massive PPH, requires many unit of blood transfusion. After how many units of blood transfusion FFP is given? Ma'am, 4 unit of blood transfusion.
Ma'am, I
4
don't have
units.
this question.
We don't
92.
have it. Okay. Okay. Let me post it for you. Hmm. Now you can see. Yes. What
Yes,
did you
ma'am.
say?
Ma'am, 4 units.
Yes,
4 units. Yeah. After.
we did it.
Yeah. 4 units. Yes. Very good. Because four we always give four. No, but recently, how many blood units of blood transfusions of FFP is given? Patient has massively requires unit of blood. How many require many units of blood? After how many units of blood transfusion requires 6 is to 4? After how many units of blood transfusion? Oh, they are asking you how many units of blood you are required. So how many blood?
Ma'am, they are asking that how much FF after how much blood transfusion you will need
Hmm.
FFP.
Yeah. After how many units of blood transfusion FFP is given?
Ma'am, if
Hmm.
there is heavy bleeding,
Hmm.
FFP is very good and it has the clotting factor as well. So if it is available, then we will give it. But till if that is not, then we will give blood. So, ma'am, after 2 units or 4 units.
First we give 6 units of blood and then we give 4 units of FFP. Always the ratio is like this: 6 unit blood and 4 units of FFPs.
Yes, ma'am. 93. Burqa is associated with breast, ovarian, and which cancer? Pancreatic. We did it last time as well.
Hmm.
94. A patient presented with heavy vaginal discharge but no itching. pH is 6. What is the cause? Candida, bacterial vaginosis, trichomonas vaginosis, vaginalis, and psychological discharge.
Yes, tell us. What you will choose?
Ma'am, pH is raised
Hmm.
and there is
No itching
discharge.
is there.
Itching is not there.
Hmm.
Ma'am,
So which organism?
ma'am, bacterial vaginosis.
Yes,
Oh,
very good bacterial vaginosis. For
okay.
trichomonas, there should be itching
Ma'am,
present.
there,
Although pH is greater than 4.5, sorry, greater than 4.5 in both of them,
yes,
but
ma'am,
itching
but
is
in
there
there
in trichomonas.
strawberry cervix and yes, ma'am, itching
Yes,
and
strawberry cervix.
but that is in trichomonas. Yeah, yes,
Hmm.
ma'am.
That
Yes,
is for
ma'am.
trichomonas, yes.
Yes, ma'am. 95. A newborn taken to the hospital with a complaint of severe vomiting. Diagnosed as pyloric stenosis. What are the electrolyte disturbances? Answer hypo that is
Hypochloremia,
chloremia. Potassium
anemia,
is also hypokalemia and alkalosis.
yes.
Ma'am, alkalosis, all three is the option.
Yeah,
Alkalosis,
this is
ma'am,
the
because
complete. Yeah, this question we did it before also.
yes,
Yes,
ma'am,
ma'am.
alkalosis because severe vomiting is there.
Mm, yes, and previously it was stenosis,
Yes, ma'am.
diagnosed as pyloric stenosis. So all in now it has been expelled out of the body in the form of vomiting.
Yes, ma'am.
And due to this imbalance occurs. Nupur has
Yes.
done this question.
Yeah, Nupur, yeah, Nupur did this. Yeah.
So, ma'am, alkalosis is answer, no?
Yes. No, three of them. It's the one statement:
Okay,
hypochloremia, hypokalemia, and alkalosis.
okay, ma'am.
Hypochloremic, hypokalemic, metabolic alkalosis.
Okay,
Yeah, metabolic. Yes.
okay. 96. What is the enzyme responsible for transcription of DNA to produce messenger RNA? RNA polymerase.
Hmm.
97. ECG of second and third degree heart block. Mm-mm.
That means RNA polymerase.
Yes.
Isn't it a DNA polymerase, ma'am?
No, RNA polymerase.
Okay, okay.
98.
Hmm.
Most common side effect of cyclophosphamide hemorrhagic cystitis. We
Hmm.
did it. Labetalol act on alpha and beta receptor. We did it. 100. A lady presented 2 weeks after her delivery with hallucination, irritability, not feeding her baby. What is the diagnosis? Postpartum blues, depression, psychosis. Um, Postpartum blues, ma'am.
Blues? No, blues happen when?
Yes, ma'am, in the start, blues are present.
Hmm.
It's
Yes, blue
depression.
happens. Yes.
Yes, ma'am.
She's irritable. She is hallucinated.
Yes, ma'am. Irritable. Yes, ma'am. And not feeding her baby.
Yes.
111. Drugs to prevent methotrexate for toxicity
It's
following.
psychosis. Depression does not have hallucination. Hallucination is a feature of psychosis.
You're saying hallucination again. This is not
Mm.
complete because
But
other
ma'am,
hmm?
this question is in some other paper was also the answer was psychosis because
But it was there in some other paper. Don't because what
um,
happened, blues occurs in first 14 days always. Like
yes,
blues is the first thing in which happens in the first 14 days,
but
and mother will not affect herself. in the blues. In the depression, what happens? She is depressed. She is irritable. But in psychosis, she will have hallucinations. She will be tearful,
Hallucination.
and it occurs in
Because
the
in the,
first 3 months of the pregnancy.
And
yes,
She is
ma'am.
hopeless.
first 3 months.
Hmm?
So there's
Psychosis
psychosis.
in first 3 months.
Sorry, what did you say, Sadam?
Ma'am, psychosis occur in first 3 months.
Yes, yeah, first 3 months. Yes.
So it is psychosis.
Yeah, if we did, I don't remember. Did we do the same similar question? Yes, if we did it, then it is going to be the same one. That's psychosis.
Ma'am, we didn't.
Okay, we
I don't
didn't.
remember.
Yeah, even I know. I don't.
If someone explained to me because I don't know these terms too much.
Ma'am, in psychosis, the patient will also do the she will also harm herself as well, I
Yeah,
think.
in psychosis, yes. In psychosis she harms herself. In blues, she does not harm herself. And
Okay,
psychosis for the 3 months period.
okay, ma'am.
And blues for 2 weeks.
111, we did it.
Yes, in blues she will not.
14 weeks.
Yes.
111, drug to prevent methotrexate toxicity is polygenic acid. 112, lady with IUCD culture shows sulfur granule organism is actinomyces. 113, protective layer surrounding the Graafian follicle. Zona pellucida, basal lamina, theca externa, theca interna. Theca interna, ma'am?
Theca interna or theca externa. Interna or externa.
Ma'am, externa then?
Yes. Okay. Let me tell you. Yes, theca externa. It is the protective layer of Graafian follicle, and zona pellucidea. It is the protective layer of the oocyte.
Yes,
These are
ma'am.
the two questions that are there. Again, you will find this question in some paper. It is there. That what is the protective layer for zona pellucida for oocyte? Then it is going to be zona pellucida. If they ask you for the Graafian follicle, it is going to be theca externa.
Okay, ma'am. Oxybutynin cannot be given to the patient of acute open angle glaucoma. 115, most common congenital heart disease of clinical importance, VSD. Type of necrosis occurring in brain is cognitive.
Hmm.
Or, ma'am, it's cognitive necrosis, no?
Yeah, it's coagulative in brain.
Okay. One is 17, ligaments that provide the main support to the bladder. Levator ani, uterosacral ligament, pubocervical ligament. I'm levator ani basically.
No, for the bladder, they're asking you.
Ma'am, pubocervical.
Yes, pubocervical for
Yes,
the
okay, ma'am. It is fine. Okay, okay, ma'am. I thought it pelvic diaphragm.
yeah pelvic diaphragm. Yes.
Okay, ma'am. 118. Post-operative patient present with the redness of the skin around the scar and nodule. What type of predominance? Neutrophil, macrophages, eosinophil, macrophages. Correct.
Hmm.
Area appear dark on ultrasound. Hyperechoic, anechoic, ma'am. That is
Yes, where it's going to be
totally
anechoic. Yes.
What's the answer for 118?
macrophages.
Macrophages.
Macrophage.
Yes. Yes.
Okay.
Mm, 120. Which system has the highest risk of teratogenicity in embryonic period? CVS, genitourinary system, lung, CNS. Ma'am, CVS,
CVS is the most chance.
genitourinary system, ma'am. In the diabetic patients, CVS is mostly affected.
Yeah,
Otherwise,
pregnancy in the embryonic period.
genitourinary.
Any other what it can be?
Genitourinary.
Genicity in the embryonic period.
And most commonly CVS.
No, mainly cardiac anomalies are.
Yes, ma'am.
Cardiac anomaly is not the CNS anomalies, the neural tube defect and this.
Highest is of teratogenicity. No?
Femtop and
No,
all.
neural tube defects are not with teratogenic drugs. Mostly it's cardiac anomalies, I think, but not sure. Because NTD is mainly due to folic acid deficiency.
Hmm. Yeah, and yeah, all these neural, yeah, they are because of the folic acid deficiency. And what about this genitourinary, the mitosis, meiosis? This is affecting the genitourinary, not this one also,
These are
because I
not
Ma'am,
think
these are not common,
cardiovascular will be
but
for
cardiovascular are more common.
and ma'am, Mullerian
cardiovascular.
and these are also genitourinary.
But
Yeah,
genital,
yes, yeah, very good. Yes, it is going to be yes, cardiovascular. Yes.
Okay, ma'am.
Although this, yeah, this neural tube defect, it is associated with that folic acid, this thing is stuff. And genitourinary, it is because of the mitosis and meiosis, not because of the teratogenicity.
Yes,
yes.
And
Ma'am,
ma'am.
this is
I've
a
Please tell them as
studied
well.
somewhere it is central nervous system.
CNS. Yeah, CNS is going to be when there is going to be that what we say when there's going
Folic
to be folic acid deficiency or problem of
Like
the folic acid.
taking
Mhm.
it's
anti-epileptic drugs or these drugs.
Yeah,
ma'am,
or
please
if the patient.
confirm this. This is I've read somewhere. I think so. It's
Okay,
central
okay,
nervous
I'll
system because
confirm
I
it.
had the
Okay,
same concept at CVS.
okay, I'll confirm it. 120, no? Okay, I'll confirm it. Yes, yes,
Okay,
Rubina.
ma'am.
Oh,
121. Which
yeah.
enzyme causes exertion of calcium? Calcitonin. 122. Major hydrogen buffer in the urine. Phosphate.
Yes, very good.
123. Treatment of chlamydia infection is azithromycin. 124. A contrast used in MRI is gadolinium. 125.
Hmm.
Indomethacin is cyclooxygenase inhibitor. 126. Newborn limb. Heart rate 104. Flaccid, pink trunk, blue extremities, cryon stimulation. What is Epgar's score? Ma'am, heart
Hmm.
rate. Okay, ma'am. Pink trunk, blue
Yeah,
extremities.
calculated.
Okay, ma'am.
5.
Ma'am, 5 point.
5, you're saying?
Ma'am, heart rate is 104, 2 points.
Hmm. Heart
Pink,
rate is 104. You give.
pink trunk,
Hmm.
blue extremities, 1 point.
Hmm.
Cry on stimulation, 1 point.
Crime stimulation is 1 or 2.
Ma'am, two. Flaccid is 0.
And baby is limp.
Yes, ma'am, so it has no point.
So limp will be 0.
Yes, ma'am. So five.
So how much would be your Apgar score?
Five.
Yes, Sadaf, Fakhra and Rubina, what is your Apgar score? Tell us.
Ma'am, 5. Mine is also
Yes,
5.
5. Yeah.
Five, ma'am.
Yes.
129 diethylstilbestrol is associated with which type of cancer? Clear
Ma'am,
cell
I don't have
carcinoma.
129.
Okay. Okay. Let me send it. Uh, mm,
Oh,
mm, okay.
now it's here.
Yes, will you continue, Rubina?
Yes, ma'am.
Okay. Yeah.
130 cause of sweating in pregnancy is thyroid hormone, placental hormone, adrenal hormone. Ma'am, placental hormone.
Mm, yes, it is placental hormone. Yes.
131
No,
neostigmine
no,
act
no, placental hormone. No, no, cause of sweating in pregnancy. What is sweating is why placental hormone? No,
Right.
what it will be?
ma'am, thyroid hormone is
Yes,
something.
very good. Yeah, thyroid.
Okay, ma'am. 131 neostigmine act as anticholinesterase. 132 lady presented with vaginal discharge. She has a boyfriend. In culture, there was a gram-negative cocci. What organism is Neisseria gonorrhea? 133 most common adverse effect of hydroxyprogesterone acetate is menstrual abnormality. Ma'am, menstrual abnormality will be answered now.
Yeah.
Okay. 134 the best investigation for breast cancer to determine receptor MRI, ultrasound, immunohistochemistry.
Yes,
Mm,
very good. Immunohistochemistry we use.
Most of the bicarbonate is absorbed in proximal convoluted tubule,
Hmm.
and the mechanism of action of botulinum toxin, that is it produces acetylcholine and that effect we
Hmm.
studied. 137 warfarin act against prothrombin.
Hmm.
One
Emprothrombin,
Hmm?
it act on vitamin K dependent clotting factors and protein C and S.
Yeah, maybe in the question there must be something written. Now that is why.
138 definition of perinatal death according to the ICD-10. What is it, ma'am?
Yes, there is one. Like according to WHO, we have there according to ICT and also.
Ma'am,
Tell us what is the
number of,
definition of perinatal death.
ma'am,
I
number
mean,
of
this
deaths
within the
per,
42 days
okay,
death
first
and then
28 days.
42 days as well.
In the 40 days when we studied in a pregnancy or post abortion
Or death due to pregnancy or termination of pregnancy
termination of pregnancy.
within
Yeah.
Yes.
42 days. This is
Yes,
supposed to
very
be.
good. Yeah.
139 DNA amplification measured by which method? PCR. 140 a lady breastfeeding for 1 year. What is the mechanism? Lobular hyperplasia.
Hmm.
141 lady with lichen planus is at increased risk of squamous cell carcinoma.
Hmm.
140 ovarian artery is a branch of abdominal aorta. 143 genotype of complete mole is 46XX.
Hmm.
And 144 regarding malignant melanoma. What is the mechanism of action of melanoma? What
Hmm.
is the most important prognostic factor? Hmm. Ma'am,
Hmm.
thickness? Oh, I
Thickness?
don't remember that. Ma'am, I don't remember that. Or
Hmm.
we will measure the diameter.
No, we measure the thickness.
Okay. Okay, ma'am. How many sperm produced per 24 hours? 30 million. And ma'am, it's finished.
Yeah, it is. Yeah. No, anyone has? I have March 2017. Any September 2000 paper has anyone has it? September 2017. So that can you have a look that you have September 2017 paper?
Ma'am, I'm searching in phone.
Okay.
September 2017.
Yeah, September 2017. Okay, this is September 2000. Yes. Okay. Yeah. Yes. Nupur, will you take the first question? 2000. This is March 2017. We are doing now.
September
Yes, ma'am.
2017.
No, first we are doing March and then September, so that we go remain in the sequence only.
March 2017, I don't have.
Okay, I have the March one. I'll share it after once we have solved it.
Okay.
Yeah.
Yes, ma'am. A 16-year-old has recently become sexually active. She complains of intensive, irritating, greenish, frothy vaginal discharge. The organism seen
Hmm.
under microscope in a drop of saline and pH is 6. Ma'am, it's
Hmm.
Gardnerella vaginalis.
Ma'am,
Yes, it is.
2016,
No, no,
September
no.
2016.
Greenish, frothy, it's Trichomonas vaginalis.
Ma'am, which paper? 2016,
No,
September?
no, no, no. In the group, I posted the questions.
Okay.
Ma'am,
So what do you
Trichomonas
Okay.
vaginalis.
get dark summarize? Because she is
Then,
running itchy and green, yellow, green strawberries.
Okay. Which artery supplies the structure derived from midgut, superior mesenteric artery?
Hmm.
Regarding influenza vaccine, what type of vaccine?
Hmm.
Field toxoid conjugated live attenuated organism subunit vaccine. Ma'am, E subunit vaccine?
Yes, very good. Just
no,
submit.
question number
Yeah.
3.
3.
Now it yes.
A 65-year-old nulliparous woman presents with vaginal spotting. A hysterectomy is performed and pathological examination of removed uterus reveals heterologous components of malignant tumor of endometrium and metaplastic cartilage. Ma'am, it's carcinosarcoma.
Yes, very good.
Mm,
Uh, for overactive bladder,
uh,
mirabegron is used. It is beta 3 agonist.
She agonist. Yes, very good. It is beta selective beta 3 agonist. Yes.
Which drug antagonizes oxytocin? Etosiban.
It is the one. Yes. Let me send the next one. Um,
Misoprostol is prostaglandin E1.
Misoprostol is prostaglandin E1, and let me send the other one.
Which of the following is side effect of terbutaline? Maternal tachycardia.
Yes, maternal tachycardia is the side effect of. Um, yes. Now tell us this
Misoprostol
one. This
allow
one
with
is
the
the
following.
answer.
Put 7. Question, seven
E1.
answer is
E1.
E1. E1.
Yeah, okay. This one.
ECG in which leads in 2-3 AVF, ma'am.
Yeah, 2, 3 ABF. Yes, very good.
What is the embryological origin of Gardner's dick? Mesonephric duct.
Mesonephric disc. Yes.
Which of the chromosomes in human have centromere located at one end? Ma'am, we did yesterday submetacentric chromosome.
Yes, very good.
Which one of the
I'm still
following?
confused in this one.
Sadaf, I am also confused. I think it should be telomere. Telocentric.
Telomere.
Telocentric.
Telocentric.
Telocentric is
Sorry,
not in human.
heliocentric.
Telocentric.
Heliocentric.
But
No,
the
ma'am.
answer given
I
is
want
submetacentric.
Nupur.
Submit.
I think it's acrocentric because I don't know in which group or from where I'm because telocentric don't exist in women.
Okay, we'll check this one.
Acrocentric.
We'll check it
Ma'am,
if we have
this is paper of which year?
March 2017.
Oh,
Which of the following stages of cell cycle immediately precedes mitosis? Ma'am, G2.
Yes.
Yes, G2. Very two.
And in
Very good.
T, it's written G1.
Sorry?
It's wrong.
In
No,
key
no,
that
that
you have
is no, that is because that what I have made it, so I am not able to change in that, and that's why I forgot that because I remember for floppy we I changed the key, but for that I didn't remember. Yeah, that was the problem.
lots of questions have wrong answer in that, ma'am. I've shared in group.
Okay, I'll see that.
Hmm. Okay, ma'am.
I'm
Urea is passive transfer.
Yeah,
Ma'am, we did
peripassive.
this.
Yeah,
Everything is
yeah.
we
It's a repeat questions. Yes, 2017. That's what I'm saying. If the question is repeated, I should not. I'll skip that one so that we can.
okay. What is the most likely histological subtype of ovarian cancer? Clear cell.
Yes,
Ma'am,
clear
I
cell.
think we did this whole paper, ma'am. It's the same sequence and everything. I think we did this, ma'am, this whole paper.
What
yes,
paper
ma'am,
you
because
think
we
we?
know all questions. How can we know all questions?
Yes, ma'am, it's the same thing.
Are you sure?
We did 2014. We did
Yeah, we did 15, 16.
2015. No, we did 2014. We did 2015. We did 2016. Right, ma'am?
Hmm. Yes. Yeah, and this
No,
is
we
17.
don't did this. Maybe it's repeated question.
Yeah. Almost all the questions I'm looking at the questions they're repeated. But let's do it. No problem.
Hope our
Okay,
paper
ma'am.
came like this, ma'am. And we all pass.
uh, the
Ma'am, the
SI
hard
unit.
paper is, sorry to interrupt, the hardest paper is from July 2019, February 2020, and now the September one is also quite a bit easy. I've studied a few questions, but these two papers are so difficult 2019 July and February 2020.
Oh, okay.
Yes, ma'am. Inshallah, you'll do in that.
Yeah, we'll do it.
Okay. What is the SI unit of radioactive decay? Becquerel. What percent of fibroid undergo sarcomatous change? 0.1%.
Hmm.
Uh, can contrast used in MRI? Gadolinium.
Hmm.
Pregnant women with nausea, vomiting,
Should not
which
be
fluid
given.
should not be given? 0.9
Hmm.
NS, 0.9 NS with KCl, 5% dextrose, Ringer lactate, Hartmann solution.
Hmm.
No.
Yes, tell us.
We have it.
Pregnant woman with nausea and vomiting, which fluid should not be given?
This is now the different question that has come.
5% dextrose.
Yes, very good. Why don't we give normal saline or any other fluid?
No, ma'am, it's
This
asking which should not be given.
Yeah, which should not be given. Why don't we give dextrose?
Because already there's electrolyte imbalance. Dextrose will only supply glucose. There won't be any electrolyte for its utilization.
Hmm. So
Therefore,
And one more thing, yes,
Ma'am, she is
yes, this,
losing potassium, she is using chlorine, sodium in nausea and vomiting,
yeah.
right?
And another one thing, yes, you're right. And one more thing, the guideline also says that because dextrose, it causes wernic encephalopathy in these patients. So
Yes,
that is
yes,
all.
ma'am. Yes, I remember.
Yeah.
Yes, okay, ma'am. Mechanism of action of ondansetron. H2 antagonist, serotonin,
Hyperpositive.
HT3, H1, D2, D2 antagonist. Ondansetron. Ma'am, I think
Three.
it's HT3.
Yes.
Aldosterone is HT3. Yes, very good. Yeah, it's
Sentinel
HT3.
T3.
A doctor is making a discharge summary for a woman who underwent laparoscopic salpingo-oophorectomy for ectopic. After 4 days, you realize that her blood group is O negative. What is the best course of action? NTD, check partner blood group and RH. There is no need for NTD as 72 hours high dose NTD. NTD in next pregnancy.
Mm.
Nurpur, please tell me the number I have lost.
39.
29.
MCQ number. Okay, thank you.
Ma'am, B, check partner blood group and RH.
Check partner blood group and RH. You're saying check the partner blood group and yes, very
And
good. Yeah,
and ma'am, we also will give NTD next pregnancy. It's the next second step.
yeah, it's going to be the second step. Yes, very good.
Okay. 19-year-old woman gives birth to her first child. She begins breastfeeding the infant. She continues, ma'am, lobular hyperplasia.
Yes, lobular
Depression.
hyperplasia. Yes,
Which of the following increases calcitonin? Excretion of calcium in kidney.
Mm,
Calcitonin.
Thousand.
calcitonin. Yes.
Hmm, I have lost these MCQs, ma'am. Which these are
31.
searching for?
Question number 31.
And then 43,
And
there's a
the
picture.
year?
Can you see
Rubina
the
Thousand
43.
picture? The
seventeen.
karyotyping. Yes, the karyotyping.
Regarding the following karyotyping, there's trisomy of 13. So, Patao, ma'am.
Yes, Patao. Yes.
61. Luteinizing hormone is structurally related to what other glycoprotein hormone? It's
FSH.
HCG, FSH, and TSH. C.
Yes, very good.
FSH.
Mechanism of action of ulipistryl acetate, selective, no,
Receptor.
partial progesterone, no, D. Selective progesterone receptor modulator.
Yes, selective progesterone receptor modulator. Yes.
A girl presented to your clinic requesting emergency contraception, LMP 20 days ago, history of unprotected intercourse 7 days ago, for which she took levonorgestrel. The couple had regular intercourse since then, and last night the condom had breached. What is the best course for action? Ulipistol as a copper IUCG, no need for additional LNG has been taken. Uh, uh, Already inhibited ovulation. And ma'am, C.
C.
No, yes. Yes, ma'am.
Why C?
Ma'am, she's already taken levonorgestrel.
Yes, very good. Yes, because she has already taken levonorgestrel, so no need for any other contraception to
Yes.
be given.
And for
Yes.
5 days it gives me.
Yeah, it is going
Uh,
to work.
which process establishes three germ layers? Gastrulation.
Yes, very good.
Which one of the following is termination of round ligament labia majora?
Yes.
Ductus venosus is completely obliterated after birth to form ligamentum venosum.
Ligamentum venosum. Yes.
Side effect of aminoglycoside is mainly by affection of which of the following nerve? Eighth nerve, ma'am. Vestibulocochlear.
Yeah,
D.
vestibulocochlear nerve. Yes.
Regarding breech presentation, what is the bitrochanteric diameter? OMG. Breech
And this
by
is between the two trochanter of the female.
Yes.
mm, bitrochanteric, ma'am. 13.
It's 10 centimeter. Bitrochanteric is 10 centimeter.
Google it.
Okay, 10.
Google.
Okay. 6 hours post laparoscopic tubal ligation, patient complaint of pain not relieved by analgesic. On
Hmm.
examination, a tender cystic mass felt under umbilicus with oozing pus from one of the port site.
Hmm.
HB11, WBC 17,000. What is your diagnosis? Urinary retention, intra-abdominal bleeding, urinary bladder injury, injury to ureter port site infection. 6 hours post laparoscopic tubal ligation, patient complains of pain in abdomen, not relieved with analgesic. On examination, a tender cystic mass is felt under the umbilicus with
Hmm.
oozing pus from one of the port sites. When port site infection.
Yes, very good. Because it is, why did you say port site infection? Tell us.
This is at the
And
site of
because
the
pus is coming and it is tender and that
Yes,
it is
very good. Yeah, very good.
umbilicus. What is the most common inherited bleeding disorder? Von Willebrand disease.
Hmm. Very good.
A, a 20-week just GA woman history of travel to India presents with chills, fever, blood test for Vivax is positive. Best treatment. Primaquine, mefloquine, chloroquine, artesunate. Ma'am, artesunate?
Artesunate you are going to give any other?
chloroquine, ma'am.
Yes, no.
Mefloquine,
Yes, no. Tell us.
ma'am, chloroquine.
Yes,
Ma'am,
chloroquine is the drug.
two drugs are given, mefloquine and chloroquine.
Yeah, but for Talciparum Vivax and that is VE, both of them we
Chloroquine.
give chloroquine is the best choice.
Okay, ma'am. Chloroquine. A woman with 150 centimeter height and 90 kg weight. What is her category of BMI? Mm.
Weight in kg divided by height in
Love
meter.
to calculate.
Okay, calculate.
You're saying it is.
Ma'am,
So,
class
hmm.
3.
Yes, very good. Class 3. Can you tell us class 1, class 2, and class 3?
Ma'am, I normal is 18 to 25, 24.9.
Yes, very good.
Then 25 to 29.9 is 1.
Hmm.
Then 30 to 34.9 is 2.
Class
And
2.
35 to 40 is 3.
Hmm.
And more than 40 is morbidly obese.
Yeah, morbidly obese. Yes, very good.
Okay. Then the
Hmm.
lowest acceptable HB in second trimester. 9.5, 10, 10.5, 11, 11.5. I
Hmm.
think it's 10. I'm confused between 9.5 and 10, but
Why are you confused? It is 10.5. Yes,
10.5.
10.5. That is the lowest
Ma'am, and
acceptable.
is what is for first and third trimester?
For first trimester, mm, yeah,
First and second 10.5 and for third 10 WHO
yeah, for third,
criteria.
yes, yeah, WHO
First and
criteria.
second is how much?
10.5.
10.
10.5 minimum at least.
And
And
third
third
is
is 10.
10.
Okay,
okay.
okay.
Thank you.
Sheehan syndrome mainly affects anterior pituitary.
Hmm.
Then pregnant women when exposed to sun gets pigmentation on cheek and face. Melasma, linea striatum, PE, polymorphic eruption of pregnancy. So
Melasma.
pregnant women when ma'am melasma.
Yes,
No.
very good.
Shh.
Yeah, okay. Mechanism of action of indomethacin COX inhibitor, ma'am.
Yes, it's a COX inhibitor. Yes, very good.
24-year-old woman. 1 minute, ma'am.
Hmm.
Yeah. 24-year-old G2 woman is seen in clinic at 12 weeks. She is known to have epilepsy with grand mal seizure, for which she is taking lamotrigine.
Hmm.
Her last fit was 1 year ago. Her
Hmm.
full blood count shows HB 9.9, hematocrit 35, MCV 110, MCH 34, platelets 1.9 into 10 raised to 9, WBC 8 into 10 raised to 9. What is the most likely interpretation of this blood count?
Hmm.
Physiological hyperemia, pregnancy, iron deficiency, folate deficiency, beta thalassemia, hemolytic anemia. Ma'am, I think it's folate deficiency. C.
Yes, very good. Explain us why.
MCV is raised and MCH is like okayish, normal.
Hmm.
So megaloblastic anemia.
Yeah, megaloblastic anemia. Yes, very good.
Normal is ma'am 85 to 95, 75 to 95 or something. MCV
70 MCV 75 to 96.
96.
Yes, less
Okay.
than 100.
Okay. Yeah. A 23-year-old woman who is 6 weeks by date is referred to EPU with vaginal spotting. Ultrasound shows irregular sac with no yolk with yolk sac and no fetal pole. There is no fetal heart activity. The ovaries are normal. Ma'am, it is threatened miscarriage. No, no,
Yes,
no, wait. But irregular sac and all that, threatened miscarriage.
yes. Threatened, or it is going to be what one?
Inevitable
Ma'am,
or
Miss.
missed. I'm just looking for that.
Yeah, tell
Wait,
us.
6 weeks
Ma'am,
by
it's
date.
irregular sac.
Yeah, that's
Hmm.
what I'm saying. It's
Yeah.
irregular sac
Hmm.
and the fetal yolk sac, but no fetal pole. And she's 6 weeks pregnant,
Hmm.
but she's vaginal bleeding. So maybe
Yeah. So what it will
inevitable
In
be?
threatened,
miscarriage.
ma'am, in threatened, there is a threat to abortion. It's not
Hmm.
aborted,
Yes.
it's
Yeah. Yeah.
threatened.
So what it will be?
Ma'am, inevitable.
Missed,
No, why inevitable?
No, ma'am, threatened only. I will go with threatened.
No, it is going to be miscarriage because no fetal pole, yolk sac. It is
irregular
But
sac.
in missed miscarriage, we don't have any bleeding. She has vaginal spotting.
No, she
So
may
she
have
is
it, no.
spotting.
So how will
She's
you know
having
that?
spotting, ma'am.
Yeah, she is having spotting. Yes.
I mean, miscarriage, it's diagnosed as no cardiac activity, but patient does not have any symptoms.
It looks like enough people. There's
Miss,
no
there
fetal
Okay.
is
Yeah,
heart.
yeah,
bleeding
I
and
agree with
spotting.
you. But if you look
Ovaries
at the options, none of the
normal.
option is fitting here
Heterotropy and variable.
because heterotropy A and B option they are out.
Yes,
The
ma'am.
Yes,
It's
ma'am. In
threatened
these
is
options, it is most
the
suitable
more
in these
suitable
options.
one. This one. Yeah.
missed
Threatened is
miscarriage.
yeah miscarriage. Yes.
Okay, ma'am.
Because irregular sac and no fetal pool and no fetal
Okay.
heart.
Okay. A 33-year-old woman is admitted with surgical wound infection after CS. Culture shows MRSA. What is the she has no known allergies. What is the most appropriate treatment? Vancomycin and vancomycin, clindamycin, both piperacillin, tazobactam, cephalosporin.
Yes, we did this. Yeah. Tell us.
Yes,
Ma'am,
Naveen.
in that the answer was linezolide. So
No,
vancomycin is a linezolide, but D, clindamycin and vancomycin.
Yes, very good. Both we will go
I think
together.
Yes. Okay. What is evidence-based medicine? Use current guidelines for treating individual using current clinical evidence to treat individual patient, using most experienced consultant advice, using current experimental evidence for treating patients, studying the most recent clinical evidence in treating patient. Ma'am,
Hmm.
answer is given. Using current guidelines for treating individual patient.
Yes, evidence based means that we are using the current updated treatment for treating the patients.
So it's guidelines, ma'am.
Yeah, yeah, that is the current. It can be nice guideline, it can be green top guideline, it can any be guideline.
Okay, ma'am. During laparoscopy, you visualize medial, ma'am. It's what are the structures? It is umbilical art.
ligament.
What does it contain? Medial umbilical ligament.
Yes, very good.
Blood supply for ascending part of colon is
Hmm.
superior mesenteric.
Yes, very good.
A study compares two types of suture materials for skin closure for CS subcuticular monofilament, subcuticular polyfilament. Who should close the skin to obtain best external validity? One consultant in each unit, anyone who normally closes skin, anyone with 3 OSAT for competence in abdominal closure, any specialist.
Nobel close the skin.
Anyone with 3 OSATs for competence in abdominal closure. C.
Any other?
Any specialist? Don't know.
Yes, any
Ma'am, one,
specialist. Yeah, yeah, the specialist.
Okay.
and one
Yeah, one.
consultant in each.
Yeah, one consultant or the specialist who is in the um,
You-
yeah, who is in the unit.
So what's the answer, ma'am?
You will do option A, one consultant in each unit.
Okay. Okay.
Ma'am, our consultant don't do skin closure. When the baby is out and uterus is fixed, they give trainees to do it.
Yeah, that is the wrong that we do it. No, it's wrong that is
But
done
ma'am,
here.
how trainees will learn? This is the way that they will learn.
external validity.
No, but the
Normally,
consultant should stand there, na? If they are giving the training, they should stand with there. They shouldn't go and dewash themselves. They should be present.
ma'am, is valid to check validity.
Hmm?
So for validity, we check which when we check validity, but any operators, then
Hmm?
same results of should be there.
Okay, I
So,
get it. Because it is an experiment, therefore a consultant is doing, is it?
yes.
Okay,
Because
okay,
it's a
So
okay.
study, na? We are doing a
each
study.
unit. So for standard study, each unit consultant should close and then check the validity of everyone separately and
Yeah,
then compare.
Okay, okay,
yeah.
okay. Got it,
Because they're
got it.
talking about the study.
Okay,
Yes.
ma'am.
Hmm.
A 22-year-old patient presents to your clinic with on and off right iliac fossa pain. During workup of pain and ultrasound shows 4 centimeters simple cyst. What is your management? Ma'am, reassure and discharge.
Yes, very good. We'll reassure
What
her and we'll,
what is the source of premenopausal estrogen secretion? Granulosa cells, ma'am.
yes.
Oh, 41-year-old women presents to clinic complaining of galactorrhea. FSH, LH, TSH are raised. A. Hypothyroidism. B. Hyperthyroidism. Premature ovarian insufficiency. PCOS. Hypothalamic dysfunction.
Hmm.
Mhm. Ma'am,
Hmm? Tell us.
ma'am, uh, this function includes it includes raised level. It's usually low only for the
Hmm?
hypothyroidism.
Yes, very good. Hypothyroidism.
Because C3
Ma'am,
also
but then
contains
why
hormone.
FSH and LH will be raised in that?
Yeah,
No,
normal
that
levels
is
of
just given to confuse you. What are the other option you can think? Then what option you will think if you consider LH and FSH? There's no other option that fits
No
here.
other option. Yeah.
That is the
O-
reason.
Okay. Diazepam can cross placenta due to lipid solubility, protein binding, large molecular weight, facilitated diffusion, active transit. A. Lipid solubility.
Yes, lipid solubility. Very good.
Okay. If your BMI is between your BMI is considered normal,
Hmm.
25 to 29.11. Okay. That's and this is androstenedione and cortisol. Okay. Which type of ovarian cancers occur with BRCA1 mutation? Clear cell, endometrioid, stromal, Krukenberg, papillary serous.
Hmm.
Mm, papillary serous?
Very serious. Hmm. Papillary serous.
Adenocarcinoma.
Hmm. Let me also think. I'm also thinking with you. It is going. Yes, papillary. Yeah, papillary serous with BRCA1. Yeah, BRCA1. Yeah, very good.
25-year-old patient presents to your clinic with history of heavy menstrual bleeding for 1 year. She has asthma. She plans to start family in a year. The bleeding is limiting her routine activity. What is the first line in management of this patient? Combined oral contraceptive pill, norethisterone, Mirena, tranexamic acid, mefenamic acid. Ma'am, tranexamic acid, D.
No first line treatment. We discuss it. What
But
is going to be?
she wants to be pregnant.
No, not after 1 year. In 1 year, she start in a year's time.
Yeah, she is saying she has a she cancer start family in a year time. Yes. Yeah. So now tell us. Yes, Nupur.
Tranexamic acid,
This is guideline for Pakistan and India.
or
Ma'am,
we'll insert Mirena for 1 year and then we
Yes.
move.
Yeah. Yeah. Then we will know because the first line is always Myrina the for HMB.
Okay,
but
so
If there's
ma'am,
Mirena.
if this line was not written like she plans to start family in 1 year time. If this line was not written like if she wants to start the family right now, then you are going to give her tranexamic acid only.
Okay,
okay.
okay. What is affected in Horner syndrome? Loss of motor supply, excessive sympathetic stimulation, excessive parasympathetic stimulation, loss of parasympathetic stimulation, loss of sympathetic stimulation. Mom, I forgot,
Yeah.
but
No
I will
problem. Yeah.
get loss of parasympathetic supply,
Sympathetic.
loss of sympathetic supply. Okay, ma'am.
Yes.
Regarding varicella zoster, what is infectivity period? 2 days before rash, 2 days after crusting appears, 2 days before rash until crust appear, 10 to 14 days after appearance of rash, 24 hours after appearance of rash when the lesion is crusted.
Hmm.
Ma'am, it's 2 days before rash until crusting appear.
Yes, very good.
But actually it's 5 days before, no ma'am?
No, no, it's 2 days before.
Okay. Okay. Gestational age is which type of data? Nominal, ordinal, interval, regression ratio. It's an with a clear zero that was ratio or interval ratio.
How ratio? Gestational ages ratio?
Ma'am, it's a
Yes.
continuous data.
Hmm.
with a
No, so
clear
how?
zero.
Hmm. Hmm.
So continuous data with a clear zero was
Yeah. What is
Interval.
interval
Ma'am,
and
it's
what
an
is?
interval. Ma'am, it's an
it was
interval.
interval.
Yes.
Okay, then
Yes.
interval.
Continuous
Interval.
is that in point form
Hmm.
there is no gap, but in with the whole digits and there is gap.
Like she can be 31 weeks. She can be 35
Con-
weeks. Any week.
Yeah,
10 weeks. So that is
continue like
inter.
31.9 and then 34. No gap in between the
Yes.
digits. It's continuous.
Exactly. There's going to be no
Interval.
gap in. Hmm.
Okay, ma'am. Which type of electrosurgical circuits is safest in theaters? Grounded, patient is attached to pad, isolation on parallel on series.
Hmm.
Patient is attached to pad or grounded.
Yes. Yeah. Attached to the pad. Yes.
B.
Very
Okay.
good.
Which of the following essential amino acids not found in omega 3 and should be taken from dietary intake? Alpha linolenic, eicosapentaenoic, arginic, arachidonic acid, histidine. Ma'am, arachidonic acid.
Yes.
What is the
Arachidonic
measurement of
acid, linoleic acid, ma'am. Linoleic
Sorry.
acid, alpha linoleic acid. Ma'am, A, alpha
yes, ma'am,
linoleic acid.
linolenic acid. Linolenic acid. Yeah,
Dietary.
yeah.
Yeah. Yeah. Linolenic. Yes.
Linolenic, yes, linolenic. Uh, then, what is the measurement of anterior posterior diameter of pelvic inlet in engagement?
Hmm.
10 centimeter, 11, 12, 13, and 9. Oblique is always 12, that is 10, and that is third. No, that is 11, and that is 13.
Very good.
14. So, what one it was? Oblique is always 12, and that is 10, ma'am?
11. 11.
11, 11,
11.
11
And
and
the
13.
transverse diameter is
13,
13. And the oblique is?
12.
Yes. And then the outlet, it becomes opposite.
Opposite.
Yes.
10. A 34-year-old woman has just returned to UK following missionary work in America. She is delighted to be pregnant, presents for booking at 12 weeks. After counseling, she agrees for syphilis test. VDRL is positive, rest all are negative. So the answer is that it is likely biologically false positive.
Yes, it
D.
is likely to. Yes, very good. It's going to be likely to be false positive. Yes.
What is the nerve that most commonly injured during gynecological laparotomy? Obturator nerve, ilioinguinal, iliohypogastric, femoral, lateral, cutaneous.
Hmm.
Obturator?
Very good obturator. Yes.
Ma'am, this
Hmm.
obturator is very important, right? In C-section, it can get injured in everything with fever.
Yeah. It is most commonly injured na, in gynecological procedures also.
It will
Yes.
not get injured in C-section. It will be injured in gynec laparotomy.
Like after C-section, I've done so many MCQs we done. Like after C-section, she's having
No, no, not after
numbness.
C-section.
She
Ma'am,
must
we
be
don't
having.
get obturator nerve in C-section.
No,
We
obturator will
have done
come down na,
50
in the thigh. Obturator nerve is in the thigh region, like in the lower limb.
like
I'm
after
just.
C-section, she has felt loss of
Okay,
sensation
okay.
on medial side of the leg, of thigh. Nupur,
Okay.
so many
Just give
questions we
me
done
1 minute.
related.
I'm muting.
Yes, Sada?
Nupur, after we have done so many questions in which obturator
Yeah,
nerve
but
is
it was
involved.
not C-section. It was always after ovarian, after some
One
ovarian
question we have done.
operation.
I've sent one question we done yesterday. That
Okay, you send, but
obturator.
I think mostly cesarean would not be involved.
But
It is in the
that's what
ovarian
I'm
fossa
asking.
where obturator
That
nerve is
what
injured.
that what I'm asking. That obturator is mainly in gynecological issues.
Yes.
So sorry, now let's continue. Yes, Nupur. Nupur, are you
Yes,
here?
ma'am.
Okay, okay,
Yes, ma'am.
okay. Yeah.
139.
Hmm.
How diagonal conjugate diameter is measured?
Hmm.
From upper border of symphysis to sacral promontory, from lower border of symphysis to sacral promontory, from back of symphysis pubis to tip of coccyx, from sacroiliac joint to opposite iliopectineum. It is the difference between ischial tuberosity. Ma'am, from lower border of symphysis pubis to sacral promontory. B.
B, yes, very good.
And it is the only which can be calculated
Yes, it is
manually.
the one which can be easily be calculated. Yes.
A woman after delivery found to be in lithotomy position for 2 hours.
Hmm.
Hello?
Yes, yes, yes. Now we can hear you. Yeah.
Ma'am, common peroneal?
Foot drop is caused by common peroneal nerve. Yes, very good.
Okay. Regarding oocyte, when the second meiotic division is completed at fertilization and ovulation, at birth, at puberty, in first 2 days of sex. Ma'am, at fertilization.
Yes, very good.
And ma'am, at first,
Regarding
at ovulation.
Yeah, first one at ovulation. Yes.
regarding wound healing process, what is the first stage? Hemostasis, inflammation, proliferation, remodeling, wound contraction. Ma'am,
Hmm.
hemostasis.
Yes, very good.
Regarding inferior vesical artery, where does it come from? Anterior division of internal iliac artery.
Yes,
A.
very good. Yes, again, very good. Yeah.
Which of the following statement best describe tidal volume? The normal volume of air displaced between normal inhalation and exhalation when extra effort is not applied. The volume in the lungs at maximum inflation. The volume of air remaining in lung after exhalation. The volume of lung that can be inhaled from end inspiratory level. The maximum volume air inhaled. Ma'am,
Normal
A?
inspiration, expiration. Yes.
A.
Yes, very good. A, yeah, very good.
Regarding cell cycle, when does chromatid separate to opposite poles?
Yes, metaphase,
Ma'am,
anaphase, tell us. Which phase?
anaphase.
Yes, very good.
What represent the two axes of a ROC curve? Ma'am, sensitivity 1 minus specificity.
Yes,
Voice
very good.
recognition.
It's not in the option. Ma'am, it's
No,
not in the option.
Yes,
it's
ma'am.
not
It is one
insertion
minus
sensitive.
D can be like it is not in the
Yeah, but always remember that this sensitivity
sensitivity is one
minus
minus
1 minus
specificity.
specificity. This, yes, it's not given in the option,
Ma'am,
but
it's not
always it
1
is
by
given.
specificity, no? It is 1 minus sensitivity
Yeah, 1
or
minus
1 by
specificity.
specificity.
No, no, 1 minus minus.
Okay, it's not in the option.
No, yeah, it's not in the option. Yes.
Okay. A condition where the uterus is bulky and adenomyosis.
Yes, adenomyosis, very good.
From what structure does ligamentum arteriosum come from? Ductus arteriosus. A.
Yes, very good.
Conversion of F3 to F2 in gut requires which of the following enzymes? Vitamin ma'am, C.
Vitamin C, yes, very good.
Vitamin C.
Yes.
What is the incidence of pregnancies complicated by cancer?
Mm.
1 in 300, 1 in 500, 1 in 1,000, 1 in 3,000, 1 in 5,000. 1 in 1,000.
Yes, very good. 1 in 1,000.
A 28-year-old woman present with 8-week pregnancy, she developed heavy bleeding and the condition is uncomplicated. What is the next step? 8 weeks, heavy bleeding, and she is uncomplicated. Expectant measurement, dilatation and curettage, vacuum extraction, mesoprostral mifepristone, surgical evacuation.
Mm.
And she is having heavy bleeding, so we cannot wait.
Mm.
We need to intervene
Mm.
and bleeding, and the condition is uncomplicated. So, dilatation and suction evac is there surgical
Suction
evacuation.
evacuation.
So, vacuum extraction. And di-
Heavy
did
bleeding and the condition
ma'am
is
vacuum?
uncomplicated. Vacuum? Why vacuum? It's not a
It is
live baby. We will apply
uncomplicated.
the vacuum.
Okay, okay.
So what it will be?
Expectant.
Ma'am, the DNC.
Yes, very good. It is going to be expectant because heavy bleeding is because she's expelling the baby. She's expelling the fetus. Once
So,
the
ma'am,
fetus is
there is chances that RPOCs can be left. So, is it good we do dilatation and curettage as she's
no, there is a
uncomplicated?
chance. That is the if condition. Again, you are talking about condition that there is a chance. But under normal condition, if the it is bleeding, then everything should come out.
Okay, ma'am.
Ma'am, but she's heavily bleeding. Can we wait?
Yeah, she is heavily bleeding. Why? Because she is aborting the baby. The baby is coming out.
Means
That is why.
everything is coming out. That's
Now
why she needs.
expelling. The fetus is expelling. Once the
But
fetus is expelled, then it
but
will
ma'am,
be. Hmm?
in condition, it is mentioned that condition is normal. Then
Yeah.
if it will be mentioned that patient is has
Or her
complication like
hemoglobin is low or something is
uh,
mentioned something any of the like she's in
low BP
hypovolemia or some then
or
we can go for surgical option. Yes.
Okay, ma'am. Expected. Okay, got that. Which of the following enzymes are used in transcription? RNA polymerase.
Yes.
What is the direct arterial blood supply of the decidua? Uterine artery, basal artery, spiral artery, straight artery, arcuate artery. What is the direct arterial blood supply of decidua?
Hmm.
I mean, it is two blood supply, direct and indirect, right?
Hmm?
They said why is two type of blood supply. Direct and indirect. Indirect from
Hmm.
uterine artery and basal artery.
And direct is from? Yes, sir.
Spiral.
Yes,
Spiral
direct is
arteries,
from.
you know.
Yes, direct is from the spiral artery. Yes, very good.
And indirect from uterine and basal
Yeah,
artery.
you're trying.
Okay.
Okay.
What is the component of placental barrier at term pregnancy? Endothelium, cytotrophoblast, syncytial trophoblast, cytotrophoblast, endothelium connected syncytial trophoblast, endothelium, syncytial trophoblast. Ma'am, D, syncytial trophoblast and endothelium.
Yes, very good.
A mother delivered her baby 2 weeks ago. Now she comes with delusions, hallucinations, psychosis.
Yeah, now this is the complete question that we did it
Okay.
previously. Yeah.
Fourth part.
What is the blood supply of foregut? Ma'am, celiac trunk.
Yes.
A multiparous woman with prolapse, which muscle is most likely to be injured?
Lap.
Pubococcygis, puborectalis, coccygeus, ischiocaverna, bulbococcygis with prolapse. Pubococcygis, ma'am?
Very good. Yes. Yes. Tell us the next one.
Regarding standard error of mean, it is by ST square root n. C.
Um. Yes. Thing is C.
Ma'am,
Mother
C.
delivery. You're telling us about the square root.
Hello?
Yes, the standard. Yeah, yeah, yeah. Standard deviation is square root by.
C.
Yes, very good. Yes, C. Yeah. Let me post the other question also. Uh, uh,
A patient comes with complaining of groin pain. A ureteric stone is suspected and X-ray is requested. At what level would you expect to see the stone? Iliac crest, paravertebral, pelvic brim, mid-clavicular line, mid-axillary line.
mm,
Mm. She's having groin pain and ma'am, pelvic brim.
yes, very good. Pelvic brim is the landmark.
Okay. Which adverse reaction is commonly and usually dose-related diarrhea?
Yes, the dose related is
Unrestricted
diarrhea.
districted.
Yes. Now tell us this one. Yeah. Okay. Calculate this one. Yeah.
Regarding the following, the mean BMI is 25%, SD is 5. What is the percentage of obese people? Okay, ma'am, I'll calculate. Ma'am, 16%.
You're saying as 16%.
How
16
you
is
calculate it? Nupur, please send it.
First, let it be right, then I'll tell.
Okay.
no, why 16%? Can you explain, Nupur?
How you guys calculate it?
Ma'am, what's the answer?
Well, first send you, Nupur. Don't tell answer, ma'am. I want to check that.
Yeah, Nupur, tell us.
What should I say? Tell how I got 16?
Yeah, tell us.
How
Yeah.
you calculate it? Tell me, please.
Yeah, I'll send the explanation. Wait.
This is ma'am through that chart which I have sent it.
Yes.
That curve, unimodal
Yes,
curve.
exactly. Yeah, that curve.
I don't know how to do it. And ma'am, the one is p is equal to 1 minus beta.
First, complete first question. Yeah, let it complete, let it understand, and then we are going to that one also. Yeah,
Okay.
we'll do that one after that.
What's this? Ay.
Okay, I also wrote it. Yeah, yeah. Okay, read it, Sada.
Okay. Um, Normal BMI is 25%, which is also mean in the problem. So 1 SD is to the right is 30%. Since your SD is 5, so 25 plus 5 is 30. Therefore, 30% is 1 SD, 35 is 2 SD, and 40 is 3 SD. And we know that 30 is BMI class 1. Obese 35% is BMI class 2 obese, and 40 is BMI class 3 obese. Wait, plotting it in a graph, we know that once SD to the right and left is 68, so 100 minus 68 is 32. Then you divide 32 to the right and the left of the curve, so you got 16% on each side. So there are 16% means favor 2.5 class 2 and class 3.
Nupur, you agree?
Ma'am,
Yes.
here mean is given. Wait, ma'am, let me explain how it
So,
is.
ma'am, answer is?
16.
Yes, you are right. It is 16. Yes.
Ma'am,
Yes, ma'am.
now I'm
Very good.
understanding. Let me explain as well. Ma'am, here the mean is 5.
Huh?
No, the mean is 25%, right?
Yeah.
In normal cases, what happened is 1 SD is equal to 68.5.
Hmm.
2 is plus 1.96
Hmm.
or 95. But here the
Hmm.
case is opposite. Its BMI is 25% mean. So one standard to the mean will be 30%.
Hmm.
We will add plus 5 in it
Yes.
because one standard deviation is here given is 5.
Hmm.
So we will add plus 5, so it will be 30%,
Yes, very good.
right?
Yeah.
You get it as 30%. And second standard deviation is why it is 35 then?
Yes, Nupur, can you explain?
What, ma'am?
How you
35. Sadaf to Sadaf 35. How does this 35 came?
Oh,
explain
okay.
me all, Nupur? My concept
Sorry?
will get clear. Explain me from the start.
Okay. See, this graph we make, it's like we draw the median, the mean, that is 25. Then on both side, on one standard deviation, 34% data will lie. 68 is total, so you'll divide it into 2. So if we wanted on the data on either side, we would have taken 68.
This is for one standard deviation. Normally 68%.
one standard
On
deviation on both side will be
On
68%.
the right
yes,
side and
I'm
on the
talking
left
about
side.
60%. I'm
So
talking about if it is
we
one
only
standard
want
deviation.
obese. We don't want underweight. So we will go only on one side. So we will see that 34.
Okay.
Did you get me? 68 by 2.
Yes.
So
So
34.
on the
But
listen, on the right side there's obese person, and on the left side these are underweight person.
yes.
Okay.
So but for one standard deviation the value is coming 30. So they are overweight. They are not obese. So we will not include them. We will not include the 34%. Then after that,
What are
the
you
next
saying?
sta- the next
Listen,
standard deviation till second standard deviation it is 13.5 on either side. So 13.5.
how
Then
13.5?
it's the 1.96 SD has 95% confidence interval. Isn't it that line?
So
According to that,
68, listen, 95 minus 68. We will do this way.
hmm, 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 hmm.
13% will left,
95
13.5.
minus 68 divided by 2.
Okay, we will divide 95 minus 68 divided by 2. So on either
Yes.
side, 13.5 divided by 2.
No, 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 no. Only 13.5. Its total is 26, 27.
Right? It is on either side is 13.5. Got it.
Yes. Then 2.5 similarly for third standard deviation and zero point 0.5 for fourth standard deviation. So
Got
you
it.
will add all this and then we get 16.
How you what and you added what? You added 25?
13.5 plus 2.5 plus zero point 0.5.
13.5, 2.5 and plus zero point 0.5. Got it.
Mm.
Now I say
Yes, Fakra and Rubina, you got it?
Nupur, what you told me that one standard
How did
deviation is equal.
13.5, 2.5, and
Yes,
I'm
ma'am,
telling
I'm
you.
25?
also
Now
confused about it.
I'll tell you. Shall I?
Yeah.
Yes, yes,
Listen. For whole graph, like one unimodal graph or Gaussian graph, what happen is one standard deviation is equal to 68%, right?
yes, yes,
Two
yes.
standard deviation
Yes.
is equal to
95,
95%, and three standard deviation is equal to
97,
99%,
99, sorry, yes.
right? We will
Yes.
divide this graph into two because here mean is given. Anything
Yes,
we will divide into two. So what will happen is that half of it will be on the right side and half of the graph will be on the left side. The right
okay,
side graph will be for the obese patient person and the left side will be for underweight patient. What happen is after dividing the graph, the value will also divide it, right? This
okay,
68% will be divided by 2. So what will left? 34%, right?
Okay.
34% to the right and 34% to the left. Then the second standard deviation is 95%. So from this 95, 68 is already inside the 95, right? So in this 95 will 95 minus 68, what will left? Tell me, Rubina.
okay,
Hmm.
I'm calculating.
95 minus 68.
90
27,
minus
7,
6.
27,
right?
yes,
Divided divide this 27 into 2,
divided by 2. Okay,
13.5.
right? So
13.5.
okay, so 134%, right?
Hmm.
The second standard deviation on the right side will be 13.5%.
Yes.
Then
first will be
then
34, second will be 13.5. Okay,
on one side,
okay,
and then
yes,
the third standard deviation it is 99%. So divide this
yes,
subtract 95 from 99,
4,
95.
4, and divide this 4 into 2,
2,
2%. So 2% on each side.
Okay.
Third standard deviation is equal to 2%.
Okay. Okay. Okay.
This
Okay.
is
Got
the
it.
way. This is
Okay. Thank you.
divided the
Yes, very
graph.
good explain. Yeah.
Okay. Then what happened is in this data, we are given mean BMI 25% and the standard deviation is 5. What is the percentage of 25% at the mean and standard deviation is 5. So we will add 13.5, 2.5 and zero point 0.5. What will give we get 16%. Got it, Rubina?
Pakra, you understood?
Yeah, yes, ma'am. Trying
Yeah.
to understand.
Like
No,
mean is
no.
already given. Standard deviation is 5. We will add 2, 3, 4. 2 and 3 we already know. And 5 is zero point 0.5. So this is zero point 0.5. The rest is zero point 0.5, zero point 0.5, zero point 0.5. Either standard deviation come. So that is equal to 16.
13.5, 2.5 would be
Like 13.5 plus 2 plus zero
5.
point 0.5, 16.
Global BMI is 45%, which is also the mean. Is 3. And we know that 130% of BMI was 145%. Closing it class, we know that 1 is the right.
Got it now?
Yes, ma'am.
Yeah. Shall we? Yes, Sadaf. Can you read the next one for us?
Wait, ma'am, I'm solving it first. Okay, ma'am.
Hmm.
Ma'am, I'll solve it first, then I'll read.
No. Okay. Okay. Yeah. Do it. Yeah. Do it. Okay.
Sugar sessions summarize the idea regarding certain
Yes. Tell us the answer of next question. Yes.
Ma'am,
Power.
it's
Sorry. Type
10%.
2 error.
10%.
10%.
Normal formula is equal to sensitivity is 1 minus beta.
Hmm.
So crossly, we want to know about type 2 error, which is also called false negative or beta error. So 1 minus zero point 0.9, it is
Yes.
percentage, right?
Yes.
Like it is percentage, so it will be multiplied by 100. So 1 minus 0.9 is zero point 0.1, and when you multiply it with 100, it is 10%.
Yes. Very good.
Now one
Yes.
formula is
Nupur, what is
power
your
is
answer
equal to,
coming? Yes.
ma'am,
Ma'am, same.
Hmm.
But ma'am, I
1
didn't
min,
know this. I need the explanation.
ma'am,
Yes. Yes.
one power is equal to 1 minus beta.
Hmm.
This is formula is like power is equal to 1 minus beta. Isn't it like this?
You're saying power equals to 1 minus.
Beta. Ma'am, this is in Oxford Division Board. Let me check it out.
Ma'am,
And is specificity is equal to 1 minus alpha?
Sensitivity is equals to, yes,
Presenting
specific, yes, yeah.
But this formula is not given anywhere. Specificity is equal to 1 minus alpha.
and this
Yeah.
is given sensitivity 1 minus beta Sadaf.
Yes, yes. I'm sending in group Nupur. It is not power. Like this sensitivity is called power of a study. I'm sending in group.
Design is made 505. Ma'am,
Send in.
151, how to calculate?
Yes, you read the explanation for us. Can you see?
Yes, ma'am.
Yeah, read it for us.
And
1
Nupur,
minus
this
beta.
specificity is not given in Oxford. I don't know about other books, but this specificity is equal to 1 minus alpha. We don't want to know anything about true negative values, so we don't know need to solve
No,
it.
she's asking in general, but yeah, this is
But
not
then
given in
I'm
the book.
asking all that if
how
you all
calculate
know, tell me.
Hmm. Yes, Fakhra, did you understand?
Yes, ma'am.
Yes,
For
very good.
power calculation 1 minus beta
Yes, 1 minus beta, yes.
and two components need to be established. First, desired calculation difference can to be detected, and the variability of the measured parameters.
Yes, Rubina, very good, 10%, yes.
Ma'am, this is Oxford book.
Yes, this is Oxford book, yes. Yes, Nupu, you will continue?
Yeah, Rupina has calculated.
Ma'am, I will also offer pay.
Hmm?
Ma'am,
Yes,
I
ma'am.
will also offer pay.
Okay, yeah, yeah,
Yeah, it's time.
Vitamin
I'll
A.
continue.
yeah.
Vitamin A has two diet sources.
You
Plant
know, one
sources.
question first, question number 6, the human papillomavirus vaccine is which type of vaccine?
Wait, ma'am. Okay. The human
Yeah.
papillomavirus is what type of vaccine? Live attenuated, inactivated, toxoid, polysaccharide based vaccine, recombinant subunit vaccine. I think it's subunit B
B beta HCG is, sorry, human papillomavirus is, um,
or no
Virus.
polysaccharide? Don't know, ma'am.
polysaccharide. And what
No,
did you
sub
say before that?
subunit.
Yes, very good. It is an example of a recombinant or a subunit vaccine. Yes.
Okay. Then vitamin A has two diet sources. Plant sources carotene and animal sources is cryptoxanthin, gamma carotene, isoretinoin, retinol.
Hmm?
Isoretinin C,
No, no.
retinol B,
Sorry, what did you say now?
retinol.
Yes, or it can be in the option, it can be given as retinoid also.
Okay.
Retinoids, they are going to be given in the option.
Okay. Okay. Then a young female, 25-year-old patient, 7 weeks pregnant, with complaint of tiredness. TSH is raised. T4 is 14. T3 is 5.4. Euthyroid, primary hypothyroidism, secondary hypothyroidism, subclinical hypothyroidism, hyperthyroidism. Ma'am, I think it's subclinical hypothyroidism.
By subclinical?
Ma'am, T4 and T3 are normal.
Normal? No, they're not high. T4 is not high. TSH is low. T3 and T4 are high. No?
T3 and T4 are high.
Yeah,
And TSH
is low.
is high, ma'am. Ma'am,
In
units
hypothyroid. Yeah,
usually
units should be mentioned usually, yes, but they're not mentioned. But from the
because
history also, with hypothyroidism, do you get tiredness?
Yes, ma'am. In hypo, we are tired, no?
Not in hyper.
Lethargic. Mm, hyper also we
And
are
this is
tired.
hyperthyroidism, isn't it?
Yes, hyper.
And
The
ma'am,
normal value of TSH.
ma'am, plant source of is keratin. Animal sources, retinol.
Yes, retinol. Yes.
It's
Ma'am,
hyperthyroidism.
normal value of TSH.
Normal value of TSH. Okay, let
Point
me just.
1 to 1 point,
Yeah, very low it is. Normal.
exactly.
1.2.
Yeah, normal.
So high.
It is 0.4 to 4 milli
0.4,
international unit.
So TSH,
0.4 to 4
so
milli
TSH is
international.
high, ma'am.
Yes. Yeah,
Yes.
TSH is high. Yes.
But ma'am, in question, in brackets, the normal values were given
Yeah, yeah. In the
in
exam,
actual
yes,
paper.
normal. Yes, yes, yes. In actual paper, you will be given the normal values. Yes.
Ma'am,
Hmm?
see, in like Google, when I googled it,
Mm-hmm.
it is like 5 to 12 is normal. So your T4 is 14. So it is normal.
So it is secondary hypothyroidism. Hyper.
I'm saying subclinical hypothyroidism.
Subclinical hypothyroidism. D.
When TSH is only
That's
raised and T3, T4 normal, then it is subclinical. That is why I'm saying subclinical.
No, okay. Let's have a general idea of this question because we don't know the units for it. Na? For euthyroid, everything will be normal limit within normal limit.
Yes, ma'am.
TSH, T3, yeah. And for hypothyroidism, what will happen? Primary?
Primary hypo TSH will be high and T3 and T4 will be low.
Yes, very good. And what about in secondary?
In secondary hypothyroidism, TSH will also be low. I don't know, ma'am.
Yes, very good. TSH, T3, T4, and TSH, they will also be low. And what happens in subclinical?
TSH will be high, T3, T4 will be normal.
T3 and yeah, TSH will be high and T3 and T4 will be low. Yes, but what happens in subclinical? Sometimes it may not manifest with its symptoms because it is
Yes,
subclinical.
yes, ma'am.
But here the question is saying she is presenting with complaint of tiredness. Otherwise, they would not have given you any symptom.
Okay, ma'am. So, ma'am, the answer is?
Hyper. But again, it
Ma'am,
will
but
depend on the units.
yeah.
Now
Okay.
just remember the general idea like that you should be able to calculate it. Like for euthyroid, all will be within normal. For primary, TSH will T3, T4 will be low and TSH high. For secondary, all low. And for subclinical, TSH will be high and T3, T4 low with no symptoms. Symptoms will not be present in the question. And for hyper, T3, T4 raise and TSH will be low.
Okay, ma'am.
Whatever
Okay.
is the question, we can do it then.
Okay, ma'am. Case of a male with azoospermia with loss of smell. Ma'am, Kalman syndrome.
Yes, now, yeah, now it's Kalman. Yeah, very good.
CNS is the most affected during teratogenicity. What is the first sensation developed in the fetus? Hearing, touch, smell, taste, eyesight. Ma'am, see, we got the answer. CNS is most affected.
Yes, yes, ma'am, we got the answer.
during teratogenesis.
Yeah, CNS is the most affected. Yes, yeah, Sadaf, you are right. CNS.
Okay.
Okay, yeah,
And what
very
is
good.
the
Yes, what is the first
hearing?
Sensation.
hearing?
They
Touch. Touch is the first sensation that the baby develops.
Okay, touch. Coronal suture lies between, ma'am, frontal and parietal. Is there
Frontal
also?
and
Wait.
frontal. Okay, coronal. Let me also think it. Coronal in between.
Between posterior part of parietal and occipital, between parietal and temporal, between two parietal bones, between temporal and occipital. A is not given, ma'am. A is the answer. Between frontal and parietal.
Yes, between frontal and parietal bone. Yes. And you have to now identify. Basically, this question is like this. I've hidden it. Okay, now read it for us.
And where?
Okay, I'm sending. Yeah, it is like this. These both are related to each other. This diagram is given.
Okay.
So you have to
Okay.
identify. Tell us which of them it is, which bone it is.
Ma'am, the answer is marked
Yeah,
parietal.
yeah, yeah, yeah. It is parietal bone, and then you have to tell us that which one it is going to be. Coronal suture. Yes, then you have to tell that. And also, let me share one or and just like this. I can't remove that answer, but let's discuss it. This is also given. This picture it is given in past MRCOG. Mhm. Okay, yeah. This is with the answer key, but just read it so that we can have an idea.
Uh, from the following list, what is likely diagnosis? Similar picture was given in exam where there is interpreted flow of the dye. Renal stone, ischemia secondary to ureteric obstruction, UTI, urethral obstruction, ureteric obstruction.
Hmm.
Okay.
Okay, so this will be the diagram. And now tell us this one.
26, ma'am, 62?
Yes.
26-year-old. Ma'am, I think above questions are left, no?
Okay. Yeah, yeah. Do it.
Okay. Patient with menopause came in profuse vaginal bleeding 1 week ago. USG was done with following finding. Uh, Point A to B 1.2 millimeter. What is your management? Ask her to come back if bleeding recurs. Give her COP. Give her POPs for diagnostic curettage hysterectomy. Ma'am A. Ask her to
Yes.
come back if bleeding recurs.
Yes. Very good.
A 26-year-old woman on COPs with ethinyl estradiol 300 microgram came in with frequent light bleeding episodes after 3 weeks of use with negative chlamydia test and negative cervical smear. What is your management? Ma'am, no need to do anything and follow up after 3 months if bleeding persists. A.
Yes, you will not do anything. Yes, very good.
64. Grade A
Hmm.
recommendation of RCOG means at least one recommended randomized control trial. B. Meta-analysis from several randomized control trial. At least one well-designed study, not randomized, well-controlled study, but not. Ma'am, B. Meta-analysis from several randomized control trial.
Meta-analysis from 7. Hmm. It is grade A. Grade A is what?
At least one?
Yes, at least one. Yeah, grade A is at least one. At least
Okay.
one randomized control trial.
One.
Okay.
51.
26-year-old, okay, 26-year-old woman on COCP with
Sit done.
ethanol estradiol 30 microgram came
Ma'am,
in.
these questions are listed
Done.
from which paper? Ma'am,
This is
which paper is
2017.
okay?
2017.
Okay.
26-year-old woman on COCP with ethanol estradiol 30 microgram came
Done.
in with frequent.
Yes, Sada.
Ma'am, this
Oh, okay,
question
sorry,
is
sorry,
done.
sorry.
She's repeating.
Yeah,
Okay,
yeah,
okay.
sorry. Drugs readily cross the placenta because of which quality? High lipid solubility. A.
Yes, very good.
HIV positive patient came with ruptured membrane, 38 weeks, already on heart, viral copy 1450. Management category 2 CS, category 3 CS with IV zidovudine, immediate cesarean delivery. Category 2 CS?
Category 2 or category 3?
Ruptured
Category.
membrane.
Hmm.
To push ruptured membrane, baby can have disease. So, and baby is already with ma'am B. Category B is madam C. Category 3 with IV zidovudine.
Yes, you will do category 3 because you have to give her some drug also. So you
Yes,
will give her
baby is already
zidovudine,
in
which is
heart.
safe in pregnancy, and then proceed with
BV.
the category 3 cesarean section.
Okay, ma'am. What type of variable is BMI? This we did. No, yeah. Continuous.
Yes, yeah. Now BMI, yes, it is an example of
Ma'am,
continuous.
it is interval, right?
Which one?
In
BMI,
continuous, it is interval.
Yes.
not ratio.
Okay, yes, ma'am. Half life of mifepristone is 5 to 10 hours, 25 to 30 hours, 45 to 50 hours, 75 to 80 hours, 95 to mifepristone is.
It is not given in the option.
What, ma'am?
The option are not correct.
Yes, ma'am.
Hmm.
This is 40 minutes, I think. 40 minutes or 40.
No,
Mifepristone.
this is mifepristone. This is not misoprostol. This is
Yes,
I'm
yes.
getting
mifepristone.
confused. That's why asking you to mifepristone.
No, B, ma'am. Like we repeat it after 2 days, like
Hmm?
after 48 hours. So
Misoprostol is
half of
40.
48, 24.
Yeah.
Ma'am, B.
Yeah, normally when you will go through when you will check the Oxford note again, it says that the normal half-life of mifepristone it is 12 to 72 hours. It is not given in the option.
Ma'am, mifepristone half-life is not given in Oxford revision note.
No, it is given.
No,
Or check
it's
my
not
slides,
given.
it is given over there.
Ma'am,
But,
your slide may be given, but I've opened book in front of me because I was confused in misoprostol.
Mhm.
Competitive
Yeah, then
prostrogenic
it is in
receptor.
my slides only. Yeah, one of them it was there because misoprostol it has an
Ma'am, we
early
will
half
guide.
life.
We will check in Google. Simple.
I checked 25 to 30.
What you check? Send it.
Sent it already.
But always remember that the half life of mifepristone is in between 12 to 72 hours. So
25 to
choose
30 hours.
no that Google will say you anything. But according to the books, that yeah, I must have searched it in the book when I was making the presentation. I might have searched from one of the books. So it is always remember that it is going to be 12 to 72 hours
Okay,
the
ma'am.
half life is.
Mhm.
Okay.
Which
12 to.
test
72.
Okay.
which test you use to check ovarian reserves? AMH.
Yes, very good.
Anti-malarial.
What is the most common cause of premature ovarian failure? Idiopathic.
Yes, it is idiopathic. Yes.
The enzyme involved in final oxidation of uric acid. Decarboxylase, carbonic anhydrase, dihydropurine, xanthine oxidase. Ma'am, it was carbonyl synthase, then it gives it releases succinate synthase, then arginine succinate lyase, then arginase used to
Mm.
give ornithine, and then ornithine again combined with urea. Like Ca- ca- yeah, with carbon dioxide and ammonia.
Hmm. So
So
what
the
it will be?
final, no, that is urea cycle. This is uric acid. So
Yes.
it might be different. Enzyme involved in final oxidation of uric acid.
Allopurinol mechanism of action is
Xanthine oxidase.
yes. This is
D, ma'am.
yes.
Yes, xanthine. Yes, very good. Yeah, xanthine oxidase. Yes.
We give it in gout.
Yeah.
Okay. Okay. Most enzymes that take part in Krebs cycle are located in mitochondria.
Yes, very good.
What is the most common cause of postmenopausal bleeding? Atrophic vaginitis and endometritis.
Yes, very good.
What is represented by the equation sensitivity by 1 minus specificity? Positive likelihood ratio.
Yes, very good. And sensory. Yes.
Ma'am,
What
what?
is positive
Yes.
likelihood ratio?
Okay.
Hmm.
What is the correct formula to calculate specificity? Um, it is true negative upon ma'am C. True negative plus false.
Yes, very good. It is true negative upon false. Yes.
Uh, Telogen effluvium hair loss is more pronounced in what stage of pregnancy? Ma'am, third trimester?
After delivery, the
After
hair loss occurs. Yeah, most hair loss they occur after delivery, immediately after delivery. And in pregnancy, the hair growth, everything increases.
Yes, ma'am.
yes, ma'am. After delivery. Rate limiting step in the synthesis of catecholamines is acetylcholinesterase dopa D. Ma'am, B dopa decarboxylase.
Dopamine carboxylase. Okay, let me.
Tyrosine, catecholamine.
Hmm.
Dopamine, carboxylase, phenyl, and transferase.
Hmm. So what it
Tyrosine
will be?
hydroxylase.
Sorry. Yes.
C.
Yes. Yes. Tyrosine hydroxylase. Yes. Very
Hydroxylase.
good.
Okay. There are three components of interaction of ultrasound with tissue medium: absorption, scattering, and the third one is
Diffraction.
uh, absorption, scattering, and cavitation, reflection, diffraction, attenuation, amplitude. There are three components of interaction of ultrasound with tissue medium. It could be
Hmm.
absorbed or reflected
Yes. Very good.
or refracted, ma'am. See,
Reflected.
B.
Reflected.
Ma'am, I
reflected.
B.
always get confused. It reflected and refracted.
No, why you?
Reflected go back on same the angle,
And
Yeah.
and
refraction,
refracted
but I
and
don't know why
refraction enter from one medium to another medium and slightly change.
its direction.
Yes.
Okay. Then increase in cell size, hypertrophy.
Yes. Increase in cell size is hypertrophy. And
Patient
hmm,
patient with ovarian mass plus pleural effusion, fibroma.
yes, very good. It is fibroma. Yes. Now tell us this one.
Primary amenorrhea, absent uterus, vagina ends in blind pouch, normal MKH,
MK.
MRKH.
Yes. MRKH. Yes.
Which one of the following bacteria produces an exotoxin Staph aureus?
Yes.
D.
Yes. It is a step for yes that produces. Now let me share one more. Hmm. Okay. Yeah. Tell us this one.
WHO defines perinatal mortality as number of neonatal death, number of stillbirth after 20, early neonatal death per thousand, number of stillbirth after 24, number of stillbirth, number of ma'am B.
Yes.
Yes, very good. Okay, let me just, yeah.
28-year-old woman has undergone emergency hysterectomy due to obstetric hemorrhage during her third pregnancy. Previous pregnancies were both C-section. Examination shows placenta has invaded through full thickness of myometrium.
Hmm. Then
Percreta.
And Krita.
in Creta.
Ma'am, if it has invaded full thickness of myometrium, it definitely reached so then
It's
it
not
shouldn't be
written here that it doesn't reach the serosa.
Yes. Yeah.
okay, ma'am.
Nupur, first you cleared my all concept.
I understand, but this question is like they should say no
Yes.
whether it's rating the
Yes, because these
serum.
questions they are not written properly. Yeah, I agree with you.
What is this full thickness myometrium? It could be in Creta, but we define the limit, then we'll answer no. We know the concept, but the question is like this.
And I'm sure that I'm gonna mark it strongly in exam. It's question like this stuff.
They'll write properly, I think. Let's see.
But in exam, question will be more clear.
Yeah, hopefully. Which type of epithelium lines the distal ear? Stratified column. Stratified squamous.
Tell us.
It's stratified squamous, ma'am.
No,
Yes,
near
ma'am.
the or near the distal urethra.
Yes,
It's
ma'am. It's
simple squamous. It's simple squamous epithelium. B.
okay. Squamous.
Because here the if the option was a stratified squamous, yes, then you will have choose that one.
Okay, ma'am. Just B.
Hmm.
31-year-old complain of subfertility for 2 years, no medical problem, BMI is high, and hormone result are FSH and LH is 1 is to 8 threes are 24. Okay, 1 is to 2 at least. Progesterone is 4, and so PCOS. She has PCOS. HCG patent, bilateral tube, USG polycystic ovaries. Male husband normal. What is the most appropriate management? Clomiphene, metformin plus clomiphene, letrozole, weight loss. Ma'am, first we advise weight loss.
Yes, very
E,
good for yes. First you will advise her weight loss.
But ma'am, we will give at the same time medicine to her, like
No.
air
First
in
is first she
Pakistan
will lose
weight loss
once she
and
lose her weight,
metformin.
she will automatically be benefited.
you only told me in UK they don't do anything.
Yeah,
Yeah, yeah. Always remember that
you'll
they
die
don't.
and they will just look at you because you
See,
have to
that's
wait for
what
appointment. I'm waiting for my gynecologist appointment, ma'am, since 2 months. I don't know when I'll get it
Yeah, it's always like this.
because they
Yeah.
told me to wait for 6 months. I thought, okay, I'll done with my exam. I'll done with UK. OET easily. I'll do it then.
Zika virus is single stranded DNA, double stranded DNA, RNA virus. We read the exception, no? Double stranded RNA was some, and single stranded DNA was one. Double stranded DNA, ma'am. B.
Zika virus is single-stranded RNA virus. C.
Okay. Sadaf, you remember we read double-stranded DNA except RNA virus, those exceptions we read, no, ma'am? We did so
Yeah,
many
I
questions.
Yeah.
remember. I'm thinking. I'm telling it now because We will remember it then. Let me tell
We
you.
read.
These were we read in Hep B, C, D, like this.
No, no,
No.
no. All viral are
No,
all hepatitis
B.
viruses are RNA except hepatitis B.
Hepatitis B.
B.
No, not this one. Double-stranded and DNA. There was like only one virus is double-stranded RNA, and only one virus is single-stranded DNA.
Hmm?
That's what I'm telling you.
There was rotavirus
I I don't remember.
and
We'll have to go back and
and
read.
one R
Ma'am,
R.
I'm doing it now. We will remember then. Wait.
Okay, okay, yeah. Tell us. Yeah.
RNA.
Okay. Um, all viruses are double-stranded DNA virus except parvovirus,
Okay.
which is single-stranded DNA virus.
Okay.
And all hepatitis B viruses are RNA except hepatitis B.
Except
All
hepatitis
single
B.
single stranded are DNA.
And all only double-stranded RNA virus is rotavirus.
Okay. Yeah. Rota
That
and
is
parvo are exception.
Parvovirus is single-stranded DNA, and rotavirus is double-stranded RNA. And
Mm,
one exception is hepatitis. So all are RNA except hepatitis B, which is DNA.
double
okay.
stranded RNA.
Thank you.
Mm.
This this is given in Oxford, yes.
This I write. I have written it.
Yeah, this
Ma'am,
is given in
when
the
ma'am was
Oxford. Yeah.
teaching, and
Yes, ma'am.
Yeah.
I also
ma'am,
I
in Oxford, ma'am, Oxford they are divided into DNA and RNA. But these specific lines we did it again and again when we
yeah,
were doing
yeah.
micro.
the all
Yes,
double
Nupur.
stranded RNA
Listen, I'm
Hmm.
except
telling you,
except parvo is single stranded, and all
single-stranded DNA.
single
All
stranded
yes,
parvo is single
parvovirus
stranded.
is the single-stranded DNA. Rotavirus
Okay,
is double-stranded RNA.
RNA.
And about hepatitis is all hepatitis viruses are RNA except hepatitis B, which is DNA.
Okay.
And now we got
Good.
it that
Good.
Zika
Yeah.
virus is single-stranded RNA.
RNA. Okay.
All have
Yes.
RNA.
Renal calculus referred pain. Ma'am, we did groin.
Renal pain. Renal pain will be going by renal pain into groin.
We did no renal
Lumbar
calculus.
region, isn't it?
Yes, renal is number. This
Posteriorly
is
Okay.
the
at the
first
back
time
face.
question. Yeah.
Ma'am, just now we did okay, it was
Groin
uret.
is the not renal. Groin is if you have a pain in the bladder, that will be towards
Yeah,
the
yeah,
groin or tip
Where
of
is
penis of male.
yeah,
That
yeah, yeah,
was Nurpur, that the stone can stuck at
yeah.
pelvic brim.
Yes, yes, yes,
Yes,
yes.
so
Uret.
that will. So, ma'am,
Okay.
it's lumbar region, right?
Yes, it's lumbar region. Yes.
Wait a minute. Yeah, okay. Then cells in the body produce hormones. Among them, how many are lactotrophs? Cells in the body produce hormones. Among them, how many are lactotrophs?
Ma'am, what are lactotrophs?
Which produce lactogen hormone.
Lactogen.
Yeah.
and these are in pituitary.
Yeah.
These cells
Pituitary.
are
Basically, they are in pituitary glands.
posterior pituitary.
Yes. Tell us how many percent they are.
That will be very low. Like that will be not
10
that
to
high.
15%.
Yes. Very good. 10 to
That's what was
15%.
in my
Yes.
mind as well.
Yeah. 10 to 15%. Yes.
HPV proliferate in basal cell of endometrium, liver, sinusoid, spleen, bone marrow. Ma'am, basal cell of
Endometrium. Yes. Very
yes.
good. Yes. Now, Fakra, you will take the question. This is
Yes, ma'am.
2017 completed. Yes, and now I'm giving you the next paper. Yeah.
This is
2018,
which paper, ma'am? Now
This
18
is,
started.
yeah, 18. Yes.
18.
Yes.
Ma'am, this is 18.
Yes. 2018.
Warfarin.
Yes. Warfarin. Yes.
Ma'am, this is first question or
Yes.
no?
Yeah. Yeah. First question. Yes. Yes.
Okay, ma'am. Warfarin acts where in the clotting cascade? Factor 5, factor 7, fibrinogen, prothrombin, vitamin K antagonist. Warfarin mainly uh, vitamin K.
Yes. Very good.
Grade B recommendation of RCOG means step 2017 grade A. At least one randomized control trial. Um, meta-analysis meta-analysis from several randomized control trials, at least one well-designed study, not randomized, well-controlled studies, but not randomized, expert opinion.
Hmm?
Um, 1 minute. That was previously we studied grade 1 recommendation. Now
Yes,
grade
yeah,
B.
now too. Yeah, now grade B. Yes, tell us, grade B.
At least well-designed and well-controlled studies. Uh, confusion between C and D. Mm,
Okay, give it
uh,
a guess. No
well
problem. Try it.
controlled, well controlled.
Well controlled, or it
Well
can be.
controlled studies, but randomization is necessary. Uh, at least well
Hmm.
designed study, not
Oh,
randomized,
yes, D.
but
Yes,
not
D. Yes, option D. That
well
is well
controlled,
controlled studies, but
but
not
non
randomized.
randomized. Yes, ma'am.
And the option A is grade A that we
Great.
did in the last paper.
At
That's why I marked it here as this.
at least one randomized control.
Yes,
Yes.
at least one.
Appendiceal artery is a branch of ileocecal, inferior mesenteric, left colic, middle colic, right colic. Appendiceal artery. Um, inferior colic, mesenteric, left colic, middle. Appendiceal artery. Ma'am, I'm not sure, but guess.
Mm.
uh,
Yeah, yeah, guess it. Appendiceal artery
ileocolic.
is a, yes, very good. It's a branch of ileocolic artery. Yes.
What is the most common cause of female urethral carbuncle? Trauma, tumor, infection, hypogastrium, congenital. This is a repeat question, I think. Infection.
Yes, you did it. Yes,
Infection.
yesterday also. This one.
Ma'am, infection.
No,
No?
no.
Hypoestrogenism.
Yes,
Hypoestrogen.
very good.
Old
Yes,
age. Yes, yes.
yes.
Okay. What type of variable is ABO blood group? Ordinal, nominal, continuous, categorical, discrete. Ma'am, mm, it's a nominal, ma'am.
Yes, it's a nominal. Very good.
Which of the following precursor of which is following is precursor of serotonin? Histidine, glycine, arginine, tyrosine, tryptophan, serotonin. Uh, serotonin, ma'am.
Hmm?
Histidine, glycine, arginine, tyrosine, tryptophan. Serotonin is the ma'am tyrosine.
Tyrosine, you're
Mm,
saying?
no, not confirmed, ma'am.
No, no. Tell us. No problem. Think and tell
One
us.
other
What
tryptophan. Tryp,
tryptophan or serotonin? Tell us now. Yes, tryptophan.
serotonin,
Yes, very good.
tryptophan.
Yeah,
Tryptophan.
tryptophan. Yes, very good.
Okay. Incidence of rare disease when translated into mathematics.
Mhm.
1 is to 100, 1 is to 1000, 1 is to 1000 into 1 into 10,000, 1 into 10,000 into 1 lakh, more than 1 lakh, more than 100,000.
Hmm?
Rare, ma'am. Rare is 1 into 100,000. No, ma'am. 1 is to, no. Best guess.
Yeah, yeah. No problem. Guess, guess.
Normally,
Yeah, no problem.
well, maybe where is
Mm-hmm.
economy? Is the question number 13? Na? Ma'am,
Yes.
normally, ma'am, if no answer, then C is the answer. Maybe C.
Maybe C. Okay, let me. Yes, C. Yes, very good. C is 1 is to 1000 into 1 is to
Um,
10,000.
10,000.
And common is, most common is 1 is to 100.
1 is to 100 is most
The most common, and
common.
rare is 1 is 10. C option, 1 is to 1,000 to 1 is to 10,000.
Okay.
Okay, let me pose the next question for you. Mm,
Rare and most common. In between, is there anything? Or most common and rare?
most common and rare.
Okay.
Ma'am, how we can differentiate it? Like why we haven't choose the D option and why we have choose the
This is
C
in the
option?
guideline given. This is fixed in the RCOG
Okay,
guidelines. It is given.
okay, okay.
Okay.
Mm, this is normal.
Infectious disease.
Okay, yeah. Now this question is correct one in the correct form written. Yes. Mm.
Ma'am, are there guidelines for biostat RCOG guidelines?
No,
No special guidelines. Okay.
no, no. Now tell us this
What,
one.
what represent the two axes of ROC curve? Two axes. Sensitivity versus one oblique specificity. Sensitivity versus oblique one minus specificity. Sensitivity versus specificity. Sensitivity versus one minus specificity. Sensitivity versus one specificity. Two curve. Um,
Which one you will choose? Nupur also did it. Tell us.
okay. Remember sensitivity minus one, that was answer,
Yes,
which goes
very
to
good.
two.
Yes,
And
very good. Tell us the next one now.
which class major histocompatibility complex human leukocyte antigen HLA uh, expressed only in extravillous trophoblast, HLA A, HLA B, C, F, and G. Histocompatibility A, ma'am, HLA.
It is G, HLA-G.
G, G, E is the answer. Okay, G, HLA, G.
G, that is found in the extravillous trophoblast.
Okay. You are carrying out analysis of a new test of
Hmm?
for DVT, DVTs, and decide to plot a receiver operating.
Hmm?
Characteristic curve. What are the axes of the curve? Sensitivity versus specificity, specificity versus sensitivity, positive predictive value versus negative predictive value, sensitivity versus one minus specificity, sensitivity versus specificity. New test for DVT and decide to plot a receiving operating.
Hmm?
Uh,
You told us now.
um, Sensitivity minus one
Yes,
over specific D, ma'am.
yes, yes. Sensitivity versus 1 minus specificity.
Okay. And 105. A 23 years old woman who is 6 week by dates is referred to EPU with vaginal spotting.
Hmm?
EPU means
Early pregnancy.
excreta,
Yes, you
early
early pregnancy.
pregnancy.
Hmm.
Okay, with vaginal spotting, which continues today. Ultrasound shows fetal pole with a CRL 4 mm. There is no fetal heart action noted, and ovaries and adnexa appear normal. What is the most likely diagnosis? Heterotropic pregnancy, viable intrauterine pregnancy, could be viable pregnancy, no viable pregnancy, threatened miscarriage.
Hmm.
6 weeks. Huh?
Yes, tell us.
Um, Could be viable pregnancy
Yes, very good. It could be a viable pregnancy. Yes, very good.
because repeat ultrasound and then fetal heart can appear,
Yes,
can be
exactly.
repeated
The best management is to repeat the ultrasound. Yes,
after 1 week.
yes.
And number of carbons in estrogen 18, 19, 20, 21. Uh,
Hmm.
Maybe it's a repeat question. I don't
No, no,
remember.
it's a
New
no, no, it's not
question.
an. Yes, it's a new question. Yes,
Number of carbon. Um, 20.
it's 18. 18 carbons are
18,
present.
18 carbon. 17, 18 carbon. Okay, ma'am. And most common endocrine disorder in reproductive age group, diabetes mellitus, PCOD, premature ovarian failure, hypothyroidism, hyper. Diabetes is the most common disorder
No,
in
diabetes.
no,
No.
PCOD. Sorry,
Yes,
sorry.
very good. Yeah, it's PCO.
PCOD.
In the non-pregnant woman, it can
In
be
pregnant woman, diabetes, and in
no,
non-pregnant,
in the
PCOD.
reproductive age. Sorry, in the reproductive age, it is going to be for the woman. It is going to be PCO.
PCO.
Yes.
But
And
in
in the
pregnancy,
non-reproductive ages,
ma'am, if this
hmm,
question is
hmm,
like this, most common endocrine disorder during pregnancy,
hmm.
then diabetes,
Yes, then it will be diabetes. And if they ask you most common disorder in men and women both, then again it is going to be diabetes.
diabetes. Okay.
Yes, tell us now.
Which this is very large and perineal nerve supply with diagram. What is
Hmm,
the
yes,
nerve?
yeah.
S234. Ma'am, answer is given. Is
Yeah,
this
yeah, answer
this is
is given because the
suitable?
diagram cannot be answer cannot be removed, na? Yeah, so that you understand that this type of question is also given in the exam.
Okay, ma'am. So, and next question is
Huh?
Ma'am, is
Yeah.
structural
pudendal
diagram.
nerve
Yes, S2,
S234?
S3, and S4. Yes, pudendal nerve. Yes.
Slender nerve. And structural diagram to which carbon number base will attach. Then this is
Yeah, this is
A
the diagram. So at 1.1, you will attach. So because
one,
in 5, you can see it is already attached, 0H. So in 1, you will attach it now. Only 1 is empty, where it is not attached. So you will attach it at 1.
one. Okay. And next, how much in the UK population has RH negative blood group? The answer is given
Yeah,
15%.
15% of them, they have the
RH negative.
negative blood group. Yes.
And next question.
Hmm.
Two most common dermatitis in pregnancies: atopic dermatitis, polymorphic, pulsatile, pustule,
Hmm.
and cholestasis,
Hmm.
pemphigoid and cholestasis, polymorphic and pemphigoid and polymorphic and of the most common dermatitis. Ma'am,
Hmm.
uh, polymorphic and
Polymorphic and
pem, pemphigoid.
pemphigoid is most common. No, which one you see most common in pregnancy?
Atopic dermatitis and polymorphic. A.
Polymorphic and ops cholestasis. Ops cholestasis is
Of
more common.
cholestasis. Oh, ma'am,
So
of
it will be option
D. E.
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 Yes, very good. Yes, E.
Two most common dermatitis in pregnancy. Okay. But more common in UK.
Yes.
And the most common protozoan cause zoonotic infection, cerebral calcification, retinitis,
Hmm.
chlamydia, plasmodium, toxoplasma, and trichomonas, and Gardia lambia. Most
Hmm.
common protozoan cause zoonotic infection, media plasmodium, zoonotic, plasmodium.
Toxoplasmodium causes what? Tell us.
Zoonotic mean cerebral calcification and retinitis.
Hmm.
It will cause. So
Plasmodium will cause what?
Plasmodium falciparum. No, ma'am, that malaria.
Yes,
Plasmodium.
yeah. So what it will be here?
Giardia, ma'am. Giardia?
No,
No. Ma'am,
no.
this is uh, animal origin and
Hmm.
Plasmodium toxoplasmosis. Ma'am,
Hmm.
toxoplasmosis.
Yes, very good. Toxoplasmosis causes this.
Cats and sheep. Okay.
Hmm.
And zoonotic means animal transmission.
Yes,
So
zoo.
it is
Yeah, zoo. Yes.
and retinitis. Okay. And uh, uh, parax- paroxetine is the teratogenic to which organ? CVS, CNS, craniofacial, kidney. Ma'am, teratogenic or CNS?
Hmm. CVS.
Yeah.
Now this they're
CVS,
asking you specific. Yes, this is the specific drug they are asking you.
parox-
Paroxetine. That was for any normal, any like any teratogenicity. Now they're asking you paroxetine.
okay,
It
ma'am.
causes damage to which it causes
CVS,
to
CVS
CVS. Yes,
abnormality.
yes, yeah.
Which electrolyte is involved in central pontine myelinosis due to fluid overload? Potassium, sodium, calcium, magnesium chloride. Central uh, fluid overload, ma'am. Sodium.
Yes, very good. It is sodium. Yes.
At term, Gravida 2, wearing a seat belt, has a car accident. She has abdominal pain and consult you for NTD. He does not need NTD 250, International Euro NTD 500, NTD 15, and perform clear test. At
Hmm.
wearing seatbelt and car accident, she has abdominal pain. Ma'am, she
Hmm.
doesn't need
No, she does not need. Why?
it.
She does not
Ma'am,
need it.
otherwise perform clear uh, at term. So she had trauma. So
Hmm.
if, that is 500 international.
Yes, very good. You are going to give her 500 international because she is a
Okay.
term. If she was less than 20 weeks,
Ma'am, her blood group is
Then
hmm?
250. Then 250.
Yes, then 250.
And
Yes, yes, Rubina, you're very right that her blood group is not mentioned.
uh,
Ideally, the blood group should be
she
mentioned.
has abdominal pain and concern. So she does not need our what answer?
No, no.
Blood
You
group
will
is not
mark her.
mentioned.
Yeah, yeah. No, no. In the exam, the blood
So
group will be
perform.
given to you.
Okay.
Yeah, 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 yeah. It is going to be three option, and you'll give her 500 international unit.
Okay. And 130 delta perin is in a low molecular weight heparin is measured using APTT, PTINR, and anti-factor 10 activity, and congenital conjunctivitis organisms. No, no, this is a new question. Ma'am, if delta for low molecular weight, we measure
Hmm.
anti-10
Yes, very good. We measure anti-10. Yes, very good.
and congenital conjunctivitis organisms purulent discharge 36 hours after birth. Conjunctivitis organism. Okay, ma'am. Chlamydia, Neisseria. I mean,
Hmm. So, what you will
uh,
choose? Tell us.
ma'am, in book it is mentioned more Neisseria gonorrhea cause this, but chlamydia also caused
Hmm. Yes.
conjunctivitis and
Yeah. So what you
So
will choose?
chlamydia.
Yes, very good. Chlamydia. Why not Neisseria? Because Neisseria also causes conjunctivitis, but it causes in the
It is a
first
rare.
48 hours. After that,
First one.
chlamydia causes.
Okay, discharge after birth. Children discharge. And in first 48 hours, Nigeria and then
Yeah, Neisseria, gonorrhea, and then chlamydia.
piezoelectric used in MRI, PET, ultrasound, X-ray. So,
Which it is used.
piezoelectric. Mm, uh, exactly, I don't know, but
No problem. Try it out.
MRI, MRI,
In ultrasound, we use piezoelectric
ultra,
effect. Yes,
ul-
yes.
what is the
In
answer?
ultrasound. C.
C, ultrasound. Okay.
Yes.
Target hemoglobin with oral and IV iron. Uh, Oral 0.8 gram per deciliter per ml, 1.2, 1.5. With oral and IV, 0.8 normal.
Yes, very good. And for blood?
1 gram.
Yes, very good. For blood, it is 1 gram. Yes.
In ECG, T wave represents
Can you
atrial.
repeat? Can you repeat what?
Target
Um,
hemoglobin oral and IV iron, it is 0.8 gram. It raises after using it. And with blood, if we give 1 pint of blood, so it raises hemoglobin by 1 gram.
Okay.
And in ECG, T wave represents atrial depolarization, ventricular depolarization, ventricular repolarization, atrial repolarization. Oh, that's a difficult question.
Mhm.
Exactly,
Try it out. No problem.
mm, ma'am, it's a mm, atrial depolarization, ventricular T wave. Ma'am, atrial depolarization,
C.
atrial C, ventricular
Yes.
repolarization.
Yes. In T wave, ventricular repolarization happens.
C, ventricular repolarization. And HSG is done on what day of the cycle? 1 to 5, 6, 6 to 12, um, 13. Ma'am, beta HCG, na?
Yeah, no, beta hydrogen, na
HSG.
hysterosalpingography.
Oh, okay, ma'am. Just
Yes.
after periods.
Hmm.
So 6 to 12.
Yes, very good. It is 6 to 12.
Okay, ma'am. Pregnancy rate with COCP if perfectly complained and non perfectly complained. Pregnancy rate
Mhm.
with COCP if perfectly complained and non perfectly compliant. Yes, ma'am. I was
Mhm.
if COCP 0.05 to 0.1 to 5.6. MB.
B, yes, very good.
And INH metabolism by acetylation, oxidation, reduction, conjugation, sulfonization. INH isoniazid metabolized by conjugation.
Any other?
Um, other sulfonization. E sulfo
It is acetylation. Ionized mechanism is the
acetylation.
acetylation. And
Acetylation.
what does ionized stands for?
Isoniazid.
Yes, very good. Which is used in the treatment of
And
tuberculosis.
tuberculosis.
Yes, very good.
And muscles of the internal sphincter derived from longitudinal muscles, circular muscles, levator ani, external anal sphincter. Muscles of internal sphincter derived from longitudinal muscles, circular muscles, levator ani. Ma'am, circular muscles.
Yes, very good.
Yeah. And cardiac output after delivery less than 20%, 20 to 40, 40 to 60, 60 to 80, more than 80 after delivery, ma'am. Uh,
Hmm.
6, more than 80?
More than 80%,
No,
60
or
to 80%.
60 to 80%.
80% after delivery.
Okay, ma'am. It's a normal range.
Yes, it is a normal range after delivery.
What does the inferior rectal vein drain? Superior mesenteric, superior rectal vein, external pudendal vein, middle rectal vein, internal pudendal vein. Uh, inferior rectal vein drain, superior mesenteric, inferior mesenteric, external pudendal, middle rectal.
Hmm.
Inferior rectal, ma'am, middle rectal and no, and internal pudendal vein.
Yes, very good. Internal pudendal vein. Yes, very good.
IUD plus pregnancy. What is the risk of ectopic pregnancy? IUD means intrauterine device.
Yes, yes.
Um, ectopic 1 is to 10, 1 is to 50, 1 is 20, 1 into 5, 1 into 100. Ectopic pregnancy, ma'am, lowest risk normally 1 is to 5
Yes,
or
1 is to 20. 1 is to 20 is the risk.
120. Okay,
Yes,
1 is
1
20.
is
It's a
to
very
20.
high. Ma'am, are you intrauterine device? So it,
No, high risk, no, it's low risk. No, out of 20 women, one woman will only have
okay,
risk.
out of 21 women. Okay, ma'am.
Yeah.
1 is to 20.
Hmm.
Which of the following is true for a patient whose pre-transfusion blood type is group O? Please select which of the following is true for patient whose pre-transfusion blood group is O? A B antigen, negative antibodies, A antigen, uh, plus B antibodies, B antigen, negative antibodies, A B antigen plus anti-A and anti-B antibodies, AB antigen and AB antibodies.
Hmm.
Uh, B blood group O has no AB antigen plus and anti-A and B antibodies. AB antigen and anti plus AB antibodies.
Hmm. What will person have? Tell us.
Uh, no, normally O group has no antigens. I
Yes,
think
very good. O group does not have antigen. So what will be here?
minus A, ma'am D. No negative and AB antigen and no
Yes, very good. It is going to be AB
anti
antigen plus anti-A and anti-B antibodies. Yes.
antibodies. 179, 50 years old female had hysterectomy 2 hours ago. The nurse noticed that urine output was 35 ml per hour in the past 2 hours. What is the normal rate of urine output? per hour, 0.25 milliliter per kg per hour, zero point 0.5 ml, ma'am, 0.5.
Yes, very good. It is going to be 0.5 ml per kg per hour. Very good.
Thromboprophylaxis on patient with hyperemesis and until discharge all throughout the antenatal period, up to first trimester only and 3 days after commencement. Thromboprophylaxis on patient with hyperemesis
Hmm.
until discharge all throughout antenatal, uh, up to first trimester. May first trimester
Any other option?
uh, until discharge.
Yes, very good. In hyperemesis gravidum, we always give the thromboprophylaxis throughout because she is at a risk of having DVT.
Okay, ma'am.
That is why.
So
Hmm.
answer is
A.
A, until discharge. Okay.
Yes, until discharge. Yes.
Endometrial tissue. Tissue found within the myometrium is adenomyosis.
Adenomyosis. Yes, very good. It is adenomyosis. Now I'm sending you the paper. It's okay. Which
Uh,
here? It is B.
Nurpur
Nupur,
is
it's
asking B.
yeah, B. Let me send you the paper.
Ma'am, it is
Yeah.
complete now, 198.
Yeah, this one is complete, and now I'm sending the other one because it does not also have the options. But let's do it so that
Okay.
we'll know. Yeah, okay.
Answer
Will you
is
open this
given?
file? Yes, you
Yes,
open
ma'am.
this file?
Yes,
Okay,
ma'am.
okay.
Answers are given. Oh, I'm opening this 1 minute.
Yeah, only yeah, one options are given or no options are given in some of them.
IgG passing through the placenta, active transport, passive transport, phagocytic diffusion, pinocytosis, or IgG.
Yes, IgG passes through the
And this paper is of which year?
2018.
18.
Yes.
Um, IgG passing through the placenta.
Hmm?
IG, phagocytic.
Which IgG passes through the placenta? Tell us. IgG passes through the placenta through which mechanism? Sadaf used to tell us every time. Tell us.
Uh, the,
Yes,
mm,
Sadaf used to tell us. Yeah, tell us.
I will try to remember. Mm, and passive transport.
Any other?
Dif-
Yes, Sadaf,
other
tell us.
Sadaf can help me.
Yes, Sadaf will tell us.
I think Sadaf is
Hmm?
not here.
Okay, okay, no problem, no problem. It, it is through phagocytosis, immunoglobulin G.
Oh, phagocytosis. Okay. And usual questions of atosiban, labetalol, hydralazine. These are
Yeah, just the quiz, these given.
and receptor on which zona X, serotonin, histamine, muscarinic,
Tell us. Zofran is endosterone drug.
androsterone. So it
Aldosterone X
is
on which?
zolpidem and it will act on um, serotonin
Yes, very good. It acts on serotonin receptor. Yes.
and nature of heparin.
Yes,
Heparin is
heparin is what?
one minute. Heparin. Nature of heparin is a glycoprotein, polypeptide, polysaccharide, or protein. Heparin is a um, pro- low molecular weight protein.
Yes,
Like
it's a glycoprotein. Yes, very good.
glycoprotein. And this picture, ma'am,
Hmm.
is it a question? Heparin
Yeah,
is a
okay, read,
unique
no, no, no,
polysaccharide.
read this so that you will come now. Heparin is a unique polysaccharide. Heparin is an
Polysaccharide.
example of a polysaccharide, it says. Okay,
Polysaccharide
okay.
with
Hmm.
both nitrogen and sulfate present as a part of its structure. Heparin interfere with the thrombin conversion of fibrinogen to fibrin and thus acting as a powerful anticoagulant. So
Hmm.
it's a polysaccharide. Nature of heparin is polysaccharide.
Yes, it's an example of a polysaccharide. Yes.
Okay. And next question.
Hmm.
And next question is which oxytocin can be used orally? Uh, will be restricted by why oxytocin can't be used will be restricted by gastric juice. I mean,
Hmm.
and will be metabolized by liver enzyme, will cause powerful contraction, will ma'am a
Yes,
rapidly
very good.
degraded by digestive juices.
Yes.
And, and next question, ma'am, a new diagram for possible fertilization through which a complete mole can occur. Complete mole. Once from in first diagram, the diagram was something like this, and asked to identify which can form complete mole. Empty egg with one sperm or two sperm. Uh,
Hmm.
Complete mole with
In complete mode, you tell us what happens.
empty egg with two sperm.
Yes, very good. In empty egg with two sperms. So any of the picture you will be able to identify. Very easy.
That is second. Two sperm are enter in the second and third, but second is empty.
Yes, it can either be. Uh, yes, second one.
Second
Yes, second one.
is
Yes,
empty egg.
yes.
Another
Tell me,
new
ma'am, which
picture.
question is this?
Question number
Uh,
6.
Sadaf was
Question
not
number?
right.
6.
Six. Sadaf, a diagram is shown that sperm is entering the egg.
Which one? In the
Um,
file,
sec-
question number 6.
Yes,
That molar pregnancy, complete mole can occur.
yes, yes.
yes, and
Okay, okay.
this picture is
Ji,
also
ji,
given in the
ji.
okay. And
Hmm.
next one, next question 7.
Yes.
Another new
Yes.
picture about the endomyosis. It also had a leiomyoma, adenomyosis, adeno.
Hmm.
But meaning of this question, another new picture about adenomyosis. It had a leiomyoma and adenomyosis both. So maybe choice was adenomyosis.
Yeah,
And
you will
there
have to
was a
choose in the exam. This question is not correctly written.
okay. But maybe picture was shown that uniformly enlarged uterus and some
Yeah,
myoma is
so you can
also
easily identify. Yes, very good. Yeah, so that you can easily identify. Yes.
so and question was related to adenomyosis maybe.
Hmm.
And there was another MRI picture of
Hmm.
intramural fibroid, and so that fibroid within the muscle,
Yes, within the muscular layer. Yes.
and picture of a testis arrow on something looking like ductus deferens and asking about embryonic origin. Mullerian duct, mesonephric duct, Ratner duct. Um, uh, like ductus deferens and embryonic origin of
Hmm. So
when
you will have
picture
to
of
mark what, yeah. Yeah, picture is below.
an
What,
arrow means something looking
yeah.
like ductus deferens and asking of ductus deferens mem- uh,
So,
malaria
yeah, so you will have to choose that which one is the correct one. Yes.
Malarian dog female for female genital organs, huh?
Yes, Malarian
and
is for female.
and ductus deferens is a part of male.
Yes.
So embryonic but male organs are developed by paramesonephric or Wolffian
No,
duct.
no,
No,
paramesonephric is for female.
no, no,
Mesonephric
no.
is for male.
Mesonephric. Sorry, mesonephric or Wolffian duct.
Yes.
Yes,
Yeah,
mesonephric
Wolfenum.
is Wolffian.
Yes, very good. Yeah. Yes. Now comes
Ma'am,
to question number 10. MRI of submucous fibroid. So you can see the submucous fibroid is inside the
inside the
MRI.
uterus,
Yes, inside the
in the
uterus,
cavity, within the
within the
cavity.
cavity. And submucosal will be within the muscular layer.
Submucosal and subserosal outside the cavity.
It's outside
Outside
the
the
cavity. Hmm. And next they are asking in question number 11,
MRI.
case, yeah. And they've said that it is an also there can be any same MRI with an intramural fibroid also there can be
Intramural fibroid. Yes.
intramural fibroid.
And
And
case
next they are
11,
asking
case
for
scenario of ovarian cyst.
yes, 4 inches,
And
4
case
millimeter.
scenario of ovarian cyst 4 millimeter. The usual option. Stand her back, reassure. Yes, ma'am. Reassure her. 4 into
Yes,
4 centimeter. Reassure and discharge.
yes, you will reassure her. Yes.
And what is this next question?
Hmm.
12. About the Hirschsprung disease etiology,
Yes.
abnormality in circular muscles,
Hmm.
abnormality in longitudinal, abnormality in parasympathetic ganglia, abnormality in sympathetic ganglia, and absence of parasympathetic ganglia. Mm, no, exact answer is
Tell us what it is going to be.
maybe it is not confirmed.
Yeah,
Hirschsprung
no problem,
disease,
no problem.
abnormality in
Correct.
circular in parasympathetic, abnormality in Hirschsprung disease. It's a disease of some muscular disorder or ganglia.
Muscular disorder. Yes, muscular disorder.
Muscular disorder. So it's
Hmm.
circular muscles or
Circular muscle.
longitudinal muscle. Two types of muscles. Two options
Hmm.
are here.
Hmm.
So abnormality in longitudinal muscles of the GH.
Okay, in this option, what you will choose, I'll tell you what you will choose. Herpes disease. It's a problem in the now go. Okay, let me read it for you. This question I'll read it. Question number 12. Question about herping disease. You'll have to tell the etiology: abnormality in circular muscle, abnormality in longitudinal muscle, abnormality in parasympathetic ganglia, and abnormality in sympathetic ganglia. So the answer will be abnormality in parasympathetic ganglia.
Okay, abnormality in parasympathetic ganglia.
Ganglia. And what group
What
of drug is
drug
heparin?
is heparin? Peptide, glycoprotein, uh, polypeptide.
Yes, tell us.
Glyco
Yes,
protein, glycoprotein.
polysaccharide. We just did it above.
Polysaccharide, but polysaccharide is
Polysaccharide.
not an option.
Yes, not an option, but you will have. But in the exam, this option will be there because it's a recall question.
Okay, polysaccharide.
Yeah. Now question number 14.
And
If it is
patient 8 weeks gestational age with threatened miscarriage,
hmm,
uh, which
what is the
uh,
indication?
but indication of anti-D
Yes.
immunoglobulin.
Yes.
Um,
When you will give NTD?
so, ma'am, in 8 weeks, so
Patient
threatened
is if
abortion.
he is having threatened miscarriage. So what is the option? Surgical intervention, complete miscarriage, or vaginal
Yes,
bleeding? When you will give her NTD?
when surgical intervention.
Yes, very good. You will give her in surgical intervention. Now, Now you can see the diagram of direct comb test. Picture of direct comb test.
Um, Picture of
Only
direct
the
contact.
diagram is given. You have
Most,
to identify.
so
Cancer
ma'am,
in pregnancy and postpartum. Tell us which is CS breast, cervix,
most
or
common
ovary.
cancer, breast. Ma'am, this is a previous repeat.
Yes.
See breast.
Yeah. Yes. And non-ergot dopamine agonist for
And
hyperprolactinemia.
ma'am, this comb test is what?
Comb test is
Uh,
a direct globulin test, na?
okay, ma'am. Direct. And non-ergot dopa agonist for hyperprolactinemia. Gang. Uh,
Answer is
hyperprolactinemia.
given also.
Guanacolide.
Yeah,
Colide.
guanacolide is the option.
And 18, question number 18 now.
Hmm?
18.
Yes.
Post lap ligarion as daycare surgery. Patient was admitted for pain management. Give morphine after 6 hours. Patient complains of pain. A cystic swelling present upper umbilicus. Tender with oozing from poor sites. Diagnosis: urine retention, hemorrhage, and infection. Urine retention is the
It's
answer.
very good. It is going to be urinary
Okay, the
retention
same.
because it will umbilicus. Umbilicus will not be
Post,
damaged. Will not be so big.
post laparoscopic ligation,
Yes.
daycare surgery. Yes.
Ma'am, most
And
common cancer breast.
Hmm?
breast,
Most common.
yes,
Yes, breast.
breast cancer. Uh, Pentamer IgM
Hmm?
level of common. Pentamer IgM means
Yeah, they are saying that
level
question is pentamer. Which immunoglobulin is pentamer? It is immunoglobulin M.
IgM. Okay.
Hmm.
And level of common iliac arteries. Bifurcation of aorta occurs at. Okay, these are individual questions.
Yeah, these are individual questions. Yes.
Bifurcation of common iliac.
So it occurs at L4.
L4. And um, no, ma'am, and common iliac at
No.
L3, L2,
Yes, L2 is common iliac. Yes.
and bifurcation of aorta at L4.
L4. Yes.
1 minute.
Hmm.
And next is cut section of a hysterectomy specimen of a uniformly enlarged uterus. History of painful menses, the adenomyosis. Answer will be polyp, pneumomyoma, and adenocarcinoma. Mein. It will be adenomyosis, uniformly enlarged and painful menses. History.
Adenomyosis. Yes.
Adenomyosis. And most common type of malignancy in tube, adenocarcinoma. Yes,
Hmm.
it's adenocarcinoma. And peak
Yes.
hospital circulation to identify ductus venosus.
Hmm.
One question from RMI calculation. Postmenopausal bilateral solid ovarian TCA 12500 root value of ilioinguinal iliohypogastric
Hmm.
that is L1 and
Hmm.
referred pain of ovary felt near umbilicus at T10 and
Hmm.
most common intracellular cation is potassium.
Yes.
It's also repeat question.
Hmm.
And next, absorption of glucose occurs in which part? Proximal convoluted tubule. Insensible water loss is about 850 ml.
Hmm.
And what type of Zika virus? It is a single-stranded RNA virus. Is a
Hmm.
repeat. Picture of testes. What is the structure labeled? And paramesonephric duct, the embryonic origin.
Hmm.
And the vitamin causing pellagra, niacin, cobalamin, pyridoxine, thiamine. It's the niacin. And
Niacin is the answer.
what type of epithelium in the fallopian tube? Simple columnar, pseudostratified columnar, squamous, Squamous simple columnar is the answer.
Yes, very good.
And picture of placenta and cord. What type is filamentous? Vasa previa differentiate between them, and
Mm-hmm.
between filamentous insertion and vasa previa,
Yes.
and filamentous insertion of cord.
Mm-hmm.
Uh, Picture of twin on in ma'am in filamentous insertion that is not in the center,
Yes,
slightly
it is
away
not. Yeah, slightly away from the center.
yeah, slightly away from center, and
Mm-hmm.
another we read battle door where that is at near the corner
Yeah, near the end. Yes.
near the end.
Yeah.
And picture of twin gestation. What type of chorionicity? Diamniotic, dichorionic, monoamniotic, monochorionic. It's it is too early to know. This is okay. This is picture.
Yes,
Okay,
this is the picture.
dichorionic and diamniotic.
Because you can see two cavities separate.
Two
It's
separate
not okay.
cavities
Yeah.
and two placenta and two cavity.
Yes, everything is two.
And on right one it's a thin amniotic. In left one it's a lambda sign, and
Yes,
right one is a T sign. No?
yes, yes, yes.
So that is thin membrane separating. So it's a monochorionic uh, diamniotic.
Mm-hmm.
Placenta is one, but two amniotic cavities
Yes,
in right one. And next,
yes.
and these are picture twin gestation at 8 weeks, and
Mm-hmm.
picture of cut section of ovary.
Mm-hmm.
What is the structure with arrow? Corpus luteum, endometrioma, albicans. It's a corpus luteum.
Mm-hmm.
And woman 60 years with urgency or incontinence, no symptoms of stress incontinence. And what is the next step? Beta sympathomimetic agonist, beta sympathomimetic antagonist, antimuscarinic, or urogram investigation. So my answer is antimuscarinic drugs.
Yes, very good.
And photo of cervix, columnar, uh, columnar epithelium,
Yes.
uh, columnar inside is columnar,
Mm-hmm.
and immunoglobulin transport mechanism, pinocytosis. So
Mm-hmm.
immunoglobulin transport by the mechanism of pinocytosis. Piriformis supplies subcostal nerve,
Mm-hmm.
and next is the picture adenomyosis of the uterus, circumscribed fibroid. Wernicke, Wernicke caused by which vitamin? Thiamine. And GnRH is decapeptide,
Mm-hmm.
the only content of lesser sciatic foramen. Tendon of obturator or piriformis, or internopudendal vessel. Tendon of obturator is the answer.
Yes, very good.
X-ray radiation is equivalent to 22.5 days to 3 days.
Yes.
And it's a repeat question. And
Mm-hmm.
gonadal arteries is a branch of aorta.
Yes.
And this was a question. Umbilical artery branch of one thing, yes, and deep circumflex iliac is the aorta. Umbilical
Mm-hmm.
artery is branch of, and
Mm-hmm.
gonadal artery is a branch of pudendal artery.
Yes.
And calculation of odds ratio, that is a sensitivity of 1 minus specificity, is negative likelihood ratio, positive likelihood ratio
Ma'am, gonadal
of
artery is
positive.
not a branch of abdominal aorta.
Sorry, what did you say?
When
Ma'am,
gonadal artery
gonadal
is a
artery is
branch
not
of
a branch of abdominal aorta.
It's a branch of aorta, no? Yes, it is written that
No,
gonadal
is a
artery is a
branch of
branch of aorta.
Ma'am, later
pudendal artery.
it's written gonadal is a branch of pudendal artery.
No, that is just the someone who has written it. But actually, the question is that gonadal artery is a branch of aorta. This must something, some
Yes,
other
ma'am,
gonadal artery
ovarian
branch, I
artery and
think. Yes,
gonadal.
please. Yeah. Whatever options they might be remembering it over there, so they've written it just
And gonadal, like
ovarian artery. This
ovarian artery.
Ovarian
Ovarian
artery.
artery
ovarian
directly
artery, yes.
arise
Directly
from the
from.
It
aorta.
arises from the aorta, yes.
Yes.
And derive the null hypothesis from relationship of soy milk and menopause. No relation between milk, menopause and soy milk. And
Yes,
iodine
okay.
transport in
Mhm.
thyroid cell, symport, sodium, calcium. Its the answer is sodium.
Yes,
And most important role of vitamin C, collagen and immunity. Answer is collagen.
yes,
And coenzyme for collagen is the coenzyme for coumarin acts against which vitamin? Coumarin
mm-hmm.
is against vitamin K. Umbilical artery is a branch
Coumarin
of
is warfarin. Coumarin is also
warfarin.
called as warfarin.
Um, so it's a vitamin K.
Yes, it's vitamin K.
Okay. And umbilical artery is a branch of
Uh-huh.
uh, umbilical artery is the fetal life, no? Two
Yes,
umbilical arteries.
yeah, two umbilical arteries.
Which are directly arise from the descent aorta, no?
No,
I think it
it's from the external iliac artery.
external iliac arteries.
Okay,
Yes, yes,
umbilical artery is a branch of external iliac artery.
iliac artery. And external iliac from aorta.
Yes,
And deep anterior branch,
External
umbilical artery, the
iliac
branch
from
of
common iliac.
anterior branch of internal iliac.
sorry,
And
sorry,
deep circumference,
is a
ma'am,
branch.
umbilical artery is a branch of anterior branch of internal iliac.
No, it's
No,
a branch of external iliac artery. No,
external iliac. In
He
fetal
says no.
circulation, huh?
yeah.
Okay.
Yes, Rubina, what are you saying?
She said that external iliac is a branch of aorta. External iliac is a branch of common iliac and
Yes, and
common
then
iliac
common
from
iliac
aorta.
from the aorta. Yes,
External iliac is a branch of common iliac.
yes, and from common iliac till it will go
Arises
into the aorta. Yes.
External and internal.
Hmm.
aorta divides into two common iliac
Mhm.
and then further divide into external and internal
Yes,
iliac.
yes,
Yes.
And umbilical artery arises from the
External iliac.
internal
yes,
anterior and internal iliac.
yes.
External iliac.
External iliac, I think.
Which one?
Umbilical artery.
Yes, umbilical artery origins from external iliac artery. Yes.
External iliac artery. So, and deep circumference artery is a branch of external iliac and structure differentiating external iliac from femoral artery. Inguinal ligament
Hmm.
and which structure differentiates superficial perineal pouch from deep perineal membrane.
Hmm.
And Bartholin occupy which space? A superficial perineal pouch.
Hmm.
And vestibule is between labia minora, between two labia minora.
Yes.
Ondansetron inhibits 5-hydroxytryptamine.
Yes.
And one question on positive predictive
Hmm.
75%. And other question was the mode, mean mode median, some
Yes.
more biostat.
Yes.
And question on molar pregnancy fertilization.
Hmm.
And first two picture and last two for partial. And and second and third are complete mole and both ova without DNA material. And question
Hmm.
on one heart block on ECG and heart block
Hmm.
and third degree heart block.
Hmm.
And this is HI and HLB not
AB is not present. Yeah, even I don't know what it means.
HLB not present. And question on CTG pictures on history of read paper on CTG. And fetal blood sampling repeats after 30 minutes. Type 1 cesarean section and continuous CTG reassess after 30 minutes. And
Mm-hmm.
it was reassuring CTG between BC of meconium versus HB2 continuous.
Hmm.
And Nupur, no, sorry, Fakhra, you were right. Umbilical artery is a branch of anterior division of internal iliac.
Internal
Anterior
iliac.
division.
Okay.
Yes,
Anterior
yes.
division of internal iliac. Okay.
Because ma'am, I have seen picture in the 10 teachers. Okay, I will
Okay.
share
Okay.
them.
Okay. Okay. Yeah. That is why I've forgotten. Yeah. And like it's a branch of anterior division of internal iliac. Okay. Yeah.
I will share in group for 10
Yes.
teacher
Yeah.
picture.
Yeah.
Fetal circulation in initial chapters.
Okay. Yeah. Yeah.
Okay.
Yeah. Yeah. Share it so that we remember it.
Inshallah. Okay. And continuous CTG after 30 minutes, type 1 it was reassuring CTG, and because of meconium, and have to continue monitoring. And
Hmm.
question on oxytocin: why not given oral degrades by GIT?
Because of the gastric juice.
Oxytocin, because it degrades by present
Gastric juice.
Yes.
GIT enzymes, and HPLC with peak
Hmm.
at A2 and S. HbF is normal.
Hmm.
HPLC is abbreviation for human placenta.
HPLC. No, no, HPLC, that
A.
human liquid
Oh,
chromatography. That one.
uh,
Human.
okay.
Hmm.
The on blood, fetal blood, HbF fetal blood,
Hmm.
and A, HbA and HbA2, and S for sickle cell
Yes.
disease, I think.
Yeah. So what will be the your answer? You will have to tell by
Okay,
looking
ma'am.
at that picture.
And interpretation, but it is not complete. And then
Yeah. Again, this.
choices were alpha thalassemia, beta thalassemia. If HbA2 is raised more than 3.5, then beta thalassemia.
Hmm.
And alpha is if low hemoglobin,
Hmm.
but and A2 is normal in range,
Hmm.
then we will consider for alpha thalassemia, and all other
Yes.
parameters are normal.
Yeah.
And sickle cell trait, the HBS, and sickle cell disease, um,
Yeah. Any of the options we will have to choose, whatever in the according to the
at
correct
that
option.
time.
Yeah. Hmm.
Okay, ma'am. And normal interpretation may be
Yes. With
given.
yeah, it may be a repeat question also. So can we continue from here from tomorrow?
Yes, ma'am.
Yeah. So we have from page number 2008 page number finasteride. We will start from question number finasteride one.
Okay, ma'am.
I'll see if
Inshallah.
there's a good paper on this because I did not find any paper for this. So that it's good options are written so that we can understand more easily. With these
We can,
papers, it's difficult to yeah, it's difficult to do, with these papers like these
yes, ma'am.
answers.
But from these answers, we have
We get an
knowledge
idea,
about
just yeah, we just get an
idea
idea.
and background knowledge.
Yes, exactly, just for the idea purpose. But I'll see if I find any of the good paper, yeah. So we can. So inshallah, I'll continue tomorrow at the same time.
Yes, ma'am.
Okay, ma'am.
Yeah. Okay.
Thank
Thank
you,
you so
ma'am.
much. Thank
Thank
you
you,
so much.
Thank
ma'am.
you, ma'am. Allah
Thank
Okay.
you.
Hafiz.
Hafiz.
Hafiz.